Thank you very much, Anusha. Ladies and gentlemen, what a wonderful start we've had to this fabulous evening. I don't think we could have asked for a better welcome, but since I'm here, it is really my honor and my privilege to join you for what is going to be a very, very special evening. And we are all gathered here today because as a society and as each one of us as individuals, we are faced with this battle against cancer. It is a debilitating disease. It is a disease that not only affects the individual, but it affects families, and it requires all of us to collectively go out there and support. And for many of us, I would imagine in this room, including myself, it's a very personal battle, and I'm sure that each one of us, if we join hands and come together, find ways of being able to find the resilience and the strength, we can deal with it much better. Just to put things in perspective, why is this so important? Because the burden of cancer in India today, we are the third largest in the world after the US and China, and we're growing rapidly. If you just take a look at the numbers, as per ICMR, the cancer incidence in India is projected to be nearly 3 crores by 2025. That's not way out in the future, it's right around the corner. Just last year, 14.6 lakh people were detected with cancer, and more than 8 lakh people detected with cancer, in fact, succumbed to the disease. The scale of the problem, as you all know, is humongous, and it is our determination to fight this big challenge. Sanjeevani-United Against Cancer is really our practical demonstration of our commitment to be able to combat this disease. And starting now and over the next few weeks and several months, we will be in mission mode trying to raise awareness, sensitize people about what it takes to battle against this disease. We also intend to make this a conversation, and we are hoping to start that conversation here this evening. We really couldn't have done this without Federal Bank. Shyam Srinivasan, thank you so very much. Ladies and gentlemen, a big round of applause to Mr. Srinivasan and the team at Federal Bank for joining us in what has become an invaluable partnership for us at Network 18. In fact, it began during the course of the pandemic. It really started with what we now call Sanjeevani 1, which was then a campaign to try and get people to get vaccinated. It was called Sanjeevani, a shot of life. And this really is the season 2 as far as our Sanjeevani campaign is concerned. And once again, coming together to really raise awareness about an issue that requires a lot of our mind space, that requires a lot of will and collective action. Of course, early detection, as you all know, is very, very crucial when we talk about combating cancer. And so it's also wonderful to have with us on board Tata Trust. Tata Trust have been at the forefront of the fight against cancer. So thank you very much again, sir, to the team at Tata Memorial Trust for joining us here this evening and for partnering with us at Network 18. This is going to be something that requires a great amount of grit, determination and significant partnerships. And so it is my pleasure to also thank Novartis, the associate sponsor in this campaign. Thank you very much to the team at Novartis for coming on board. Many of you may not know this, but Novartis is putting together an innovative pipeline of cancer drugs and have been doing that for the past several years globally, and of course are doing that here in India as well. So we couldn't have asked for better partners to join us here this evening for the launch of Sanjeevani. So ladies and gentlemen, if you have stories that you'd like to share with us, if you have recommendations or suggestions on what you believe needs to be done at a policy level, what needs to be done at an infrastructure level, what needs to be done at a support level, do reach out to us, and we will try and ensure that we can get this conversation moving and we can get the action that is required and the interventions that are required to be made to go through. So thank you once again for joining us here this evening, and we are of course looking forward to many more conversations that we intend to have here on this stage as we take this evening forward. May I now request Mr. Shyam Srinivasan to join me up on stage. Mr. Srinivasan, thank you very much for being here with us this evening. I would request you to join me on stage to take the conversation forward. Very often when I speak to Mr. Srinivasan, it's mostly about where interest rates are headed or what's happening as far as NPAs are concerned. Today is going to be a different conversation. But first up, We're launching Sanjeevani on a day that Federal Bank stock has touched an all-time high. So congratulations on that, Mr. Srinivasan. And there's more good news. 14 years of you being at the helm at Federal Bank. And there's another piece of good news, and that Federal Bank has actually made it to the list of the great places to work as far as women specifically are concerned. So on all three fronts, a big congratulations to you, Mr. Srinivasan. How do you feel today?
Thank you, Shireen. Both excited and a little humbled by the occasion, right? I just cast my mind back to what we had in April 2021 at the peak of the pandemic at the Wagah border when we launched the Short of Life campaign. There was a sense, it was overwhelming, right? Because this occasion, at that time we were playing blind. We didn't know how to cure, at least in this there's a certain distance travel. There it was completely blind. And today I just look back and I say the bank and partnering with you guys, we made, I think, meaningful progress. We touched over many lakhs of lives. And I do think today could be the start of something very special. When I heard you say that, I think we are poised at a great place. As a bank, from what you described, we are deeply committed to doing stuff that touches society in a real way, right? And I think the more recent developments of the stock doing well or these are just shot in the arm, but I would just set that aside. The most important thing is the last one that you mentioned. Our workforce, we have 43% of our workforce is women, right? And to be an organization that is, I think, the third year in running, a great place to work for women. And if you've seen that number that's come out, we are the only Indian born, brought up, raised in India organization in the top 10. The other 9 are organizations with great pedigree and from across the world. So I'm deeply excited that the bank's women power is at show. And coming to this topic, I think they bring a lot more empathy. And that feeds into the organization's culture of what we want to do for society. So in many ways, we are poised for something special, important, and I think far-reaching. So yes,
you'll be getting my CV by later tonight, Mr.
I am not willing to lose my job, so we will wait for that.
No, but on a serious note, let's talk about why we are here this evening. And I don't know again how many of you in this room know the numbers, but the numbers are staggering. The out-of-pocket spends of an average Indian on healthcare expenditure is significant. It's still about 50% of GDP. And I was just taking a look at the last released numbers, and there's a whole bunch of estimates that are done. But according to a journal that put out numbers more recently, it talks about how the out-of-pocket expenditure, both for inpatient as well as outpatient, on a monthly basis averages anywhere between 8 to 12,000 rupees, and that is a staggering sum of money. So almost works out to about more than 3 lakh rupees annually as far as the average citizen is concerned, and you know that there is an under-penetration as far as insurance is concerned in the country. And so it's a really important aspect to focus on because, if you can catch it early, if you can ensure that you get the right kind of care, you have access to the right kind of infrastructure, it perhaps could not just alleviate the health burden, but also the economic burden,
absolutely,
Mr. Srinivasan.
Absolutely. In fact, I think one of the things, as we get deeper into this program, and as a bank, we've spoken on a few occasions, even at the board level, I think we have to start investing in the adjacencies around this. This program will certainly help increase awareness, which is our sort of bigger aspiration. But we recognize that the caregivers and the support mechanism for anybody impacted, we've seen, in fact, one of our board members has almost mandated to construct facilities like a dorm or whatever in and around the cancer hospitals to help people who are supporting, because many of them literally live on the pavement or live by getting some dole or some support, people with not enough privileges. So I think the big development that we want to make in this is, apart from this whole journey of trying to promote awareness and support people, start investing in the adjacencies and help people in a way genuinely the caregiver is not affected massively, at least financially and physically, if they can support. So it is going to be quite a important development in this journey.
No, and you bring up a very important point, because a large part of the spends are actually on account of the non-medical aspects. So it's the food, the transportation, the lodging, as you spoke of. That actually adds to the economic burden for not just the patient, but also for the caregivers, and that really is something that we need to focus on. And we're talking about huge geographical disparities in terms of just being able to access good quality infrastructure, healthcare infrastructure that people can access for specifically cancer treatment. So as part of this initiative and separate from this initiative as well, what have been some of the learnings in being able to build this out?
See, we think by a few ads and by a few messages, a large population will recognize it. At best, it's a fleeting thought for many. So one of the struggles is how do we get the grassroots really understand and work at that level. And the lesson we learned from the last round when we did the Sanjeevani one, all our blitz on channels and various platforms helped. But the real last mile, when the guy went in a bus to the local village, literally carted them back to the site to tell them why it is, give them the incentives to take that shot. So I think the biggest exercise for all of us is going to be, as we get united against cancer, is how does the last mile actually go and test, and how do we support them once the test, God forbid, if they detect something? Are we going to support them with some kind of financial support, assistance, simplifying, and then of course the treatment related. So this is a lot of work, you know it better, but I as in Federal is committed to making sure on the ground as much as possible, using physical force, using technology, we want to try and bring more people really beyond one level above awareness, getting into the, the kind of effort to go and test. And, we have to do a lot there. Our employees have committed. We have actually launched now an employee program where we give voluntary day off for doing volunteering.
Okay.
So on specific days in the bank, they are taking time off to go into local communities and penetrate the message down. So it's not just headlining, but I hope we can reach out to the ground by truly the employees themselves. We have about 15,000 of us go out and in the local communities, promote the awareness, but also encourage them to go into the testing. So it's a lot of work that needs to be done on the ground.
And many people would be curious to know that why is a bank deciding to support the cause of cancer? When we talk about the COVID pandemic and we talked about vaccination, it perhaps still made sense because you wanted the economy to restart, and one of the ways of being able to do that was to ensure that more and more people were vaccinated. But why the decision to actually join hands in the fight against cancer?
Yeah, we did think about it. See, the two big themes that we work on is one is healthcare and the other is skilling and education. On both counts, we are setting aside meaningful sums as the CSR expense of the bank and time by employees. Why cancer? You reeled out the statistics. I don't have to say more. It's truly debilitating, and we've seen almost everybody has some instance of somebody, friend, family has suffered this, and it brings a tear. I mean, most recently at the workplace, one of my colleagues, and husband and wife both work in the bank, it was remarkable to see how the lady who was affected, the guy stood by her, they literally fighting it through, raising a family through that. And the story that they related to me, you have to be really hard-hearted not to think about it twice over and say we have to reach out and do something, because many are suffering like this. So as a bank, the thought process, if you're focusing on healthcare as a big theme, and if this is something that's so important to India and to lives, why don't we spend a meaningful sum? I think our ESG is not just fancy terminology. The ESG, and this is not just my time, the bank has been quite resolutely supporting social causes for long periods of time. You may be aware, IFC, the World Bank, their largest investment in any organization in the world, the largest single organization is in Federal Bank. Right? Most recently, they went up to, they technically can go up to 9%. And they don't do things lightly. They are in it because they believe in our ESG practices. We believe in it. So we are quite committed to it, and I'm not saying this just on a platform. This is what we've been doing. The employee hours we're putting in are not light statements I make. Including me, we spend time. We spend time, we encourage people to spend time, we're paying them to go and do this in local communities in every fashion. So I think this is something fits in nicely, and I have to compliment you guys for bringing it up as a theme, and thank you for both our partners as well. So this can be quite big, and we have to do it across many years.
Yeah.
I don't think we are committed to doing it just for 6 months. Rahul and me and others, when we've spoken, we said we must look at this at a longer period. But yeah, we have to test the waters and see what impact we're making. But we must commit to doing this in a manner that is just beyond advertisement. It has to reach lives, turn lives favorably, and hopefully we'll see many more smiling faces and people fought it and come over.
Oh, absolutely. I do hope that it will lead to at least a movement of hope, as well as bringing on board some solutions to the problem that we are faced with today.
One more thing I'll just
yes.
tell you, Shireen. I know we're maybe turning, it says time's up. But I'll just tell you, a thought that's occurring, and we are looking to create some, it sounds fancy, but some AI-based capability that is going to be under our CSR initiative, which will be maybe many months, years, I don't know, to help in simplifying detection on the ground in the remotest parts of the country. I don't know, it's a long, tall ambition, but we are committed to finding some solution around it and parking some money for that. And I'm sure like-minded individuals, institutions will co-work with us, but this is something that we are committed to doing. It may take a year out, but we're going to do that.
You know, it requires collaboration, it requires deep partnerships, which is what we're hoping to do here today. We forged a very strong tripartite partnership, and we hope that we are going to be able to take this forward. It is called the Emperor of All Maladies, in the words of the Pulitzer Prize winning author Siddharth Mukherjee, and I think that it requires dedicated action. It requires collective and urgent intervention at this point in time. So Shyam Srinivasan, many, many thanks for joining us here this evening, for your generosity and for your support as always. Thank you very much. Ladies and gentlemen, this is only the start of this evening. We have plenty more coming up for you. So enjoy the evening. And as I said, this is really an opportunity for you to share your thoughts, your ideas, your suggestions with us. So please do keep them coming. Thank you very much.
Thank you, Shireen. Thank you, Mr. Srinivasan, for sharing your thoughts, and your presence truly resonates with the cause that we are trying to take forward here. Also, a quick reminder that at 8:45 p.m. today, we'll be joined by a very special panel of cancer fighters, actor and model Lisa Ray, cricketing legend Yuvraj Singh, and film director Anurag Basu. How can today's evening be complete without narrating certain human stories? Stories that tell you how to fight the demon when it's right in front of you. अब समय है एक ऐसे कैंसर फाइटर के बारे में बात करने का जिन्हें अपने डायग्नोसिस को पूरी हिम्मत और पूरे जोश के साथ उसका सामना किया। हम बात कर रहे हैं एचआर सलाहकार रजनीश सिंह जी की, उनकी कहानी, उन्होंने ये लड़ाई कैसे लड़ी, वो आज हमारे बीच में मौजूद भी हैं। मगर इसके पहले कि मैं उनसे बात करूं, आई एम प्लेइंग आउट अ शॉर्ट एवी दैट टेल्स यू हिज स्टोरी।
एक फौजी जवान की तरह जीना है, जो एक बार आगे बढ़ गया तो मुड़ के पीछे नहीं देखता। Hi, I'm Rajneesh Singh and I'm a cancer fighter. Colon cancer case, but yes, it went bad because it had started spreading, and so this was a stage 4 situation. For me, it became a battle, and so I went into that mode that this thing has to be taken head on. My closest family, yes, my wife, son, both very, very supportive, very positive, so that helped immensely. The family, the friends, they also play a big role. That's a very important support group. Just the night before I got admitted for my surgery, for some reason, I just thought whatever those 10 days had been of the tests, I thought of just writing them down. And then these 3 magic words came, you know, the good patient, that I have been hugely cooperative, and whatever I have been told, like a very, you know, sincere student, you've been just following the instructions. So that is where the names got stuck. And then I thought of doing this, I think, for the benefit of the larger cancer community, rather than keeping it under wraps. I just wanted to do it the other way around, talk about it, and let the world know that if you have the will, if you have the inner strength, you can fight it. As of now, things look absolutely in control, but yes, I need to stay watchful of any symptoms that crop up. No way I would allow the cancer to win, in the whole battle.
Ladies and gentlemen, a huge round of applause for that very inspiring story. Rajneesh ji hamare beech mein hai. He is with us today evening. So I think everybody here would want to know from you, how did you fight this? What was inside you that helped you fight this so strongly and consistently?
You want me to stand and speak? Can I sit down and speak? How do you want me to?
I think if you can stand, then everybody would be able to look at you
Absolutely.
and hear
Sure.
you very often. Why don't you come here? So why don't you join your own?
Sure. Thank you very much, Network 18. I have a very old association with the team behind Network 18. I used to be the group head HR just about 13 years back. So, world is so small when this thing happened, and I got to know that Network 18 is doing this Sanjeevani series. So very, very heartening. But yes, to the question, I think naturally for anybody, when it gets diagnosed and you're given this news, the very obvious two words that come to you is, why me? I was leading a very, very normal life, absolutely full of life, nothing missing in life at all. So the message is that it can hit you anytime, and it can hit anybody. So I think that is very, very important, that mentally you got to be super prepared for this news. And that is where the battle is. It is in the mind. For me, if I've been able to see through these 2 years, it's been purely because one has stayed very positive in the hope that one will overcome this. And I have had so many friends who have actually recovered, have had wonderful stories, 10 years, 15 years. I met an old gentleman who has actually battled cancer for 35 years. So I believe in the spirit of hope, and that is what I would like to really take forward.
Cancer as a word is scary for our families. And it's one thing to know the concept of death philosophically, and it's another to countenance the probability of it. And that's what you have to do when you're faced with a possibility like that. What was it in your family, in your treatment, or your awareness per se, that helped you to get past these hurdles, this big challenge that came into your life?
So I think we heard Mr. Srinivasan talk about the caregivers and the immediate family. I think that's a very, very important set of people that you need to have. For me, what you saw in the clip also, my wife, my son, I think they stood like pillars behind me. My wife was absolutely rock solid, and she said, don't worry, Rajneesh, we're going to overcome this. So I think for your immediate partner to give you that kind of confidence is hugely important, and that is where I gained a lot of confidence. And she just took charge at the hospital. She did all the documentation, and I was absolutely at peace with the doctors, cooperating, whatever they wanted me to do. I just kept going one step at a time, and that is how we kind of overcame the whole thing.
Thank you so much for sharing your story. You lived it, you shared it with others, so that many can take inspiration. Ladies and gentlemen, a huge round of applause. He's indeed a true warrior. Thank you for joining us today's evening. And now we move on to a very special address. We have the profound privilege of welcoming a true luminary in the field of medicine and oncology. Dr. Rajendra Badve, a distinguished surgeon and oncologist who has dedicated over 25 years of his illustrious career to the relentless pursuit of advancing cancer care and improving the lives of countless individuals. His pioneering work in breast cancer research has not only revolutionized our understanding of cancer biology, but has also yielded cost-effective methods that can be accessible to everyone. These are life-saving treatments that resonate across the world. Dr. Badve's influence extends beyond research and clinical care. He has been a mentor, a strategist, shaping cancer care and policies for the Government of India and for the World Health Organization. Ladies and gentlemen, please join me in extending a very warm welcome, a very heartfelt welcome on the stage, Director of the Tata Memorial Center, Padma Shri Dr. R.A. Badwe, a true visionary. Sir, it's an absolute pleasure to have you.
Thank you very much. There cannot be more constructive environment than to have a creative stage and the most sentient floor. Both those put together, I'm sure cancer is not going to be a big problem for India. And what I'm here for is to paint the ground reality, and towards that, I'm an eternal optimist. So you will have lots of positive things as I talk. Then move on to what can be done to prevent and what the government has done. So, when we talk of cancer, let me rattle out some numbers about the ground realities in India. When you come to Mumbai or Bangalore or Kolkata, Delhi, any of these metropolitan cities, the numbers are about 100 per 100,000 per year. So many cancer patients every year, about 100 every year, get cancer out of every 100,000. This number reduces as we go to a mid-sized town to about 65, 70. From there on, if we move to rural pockets, and mind you, more than 65% of our population is in rural pockets. In rural pockets, these numbers are 40 to 50. And we are not missing out on cancer. We have about 5 cancer registries across India in rural pockets covering somewhere close to about 5 million population, with a house-to-house survey annually done for this population, and we don't have cancer there. In fact, Bill Melinda Gates Foundation infused few $1 million in one of our places in interior of Maharashtra, about 400 kilometers from Mumbai, where because of not only all cancers put together low, but breast cancer was 9 per 100,000. And it remained 9 for about 25 years. This number in United States is about 125. 9 and 125 remaining 9. I just mentioned to you a number 45 to 50 in rural, 65, 70 in mid-sized towns, and 100 in urban population. We move on to US or any European country, the number is 350 per 100,000. Then where is the problem? If we have the cancer that is low, if you look at census, every 10 years, about 5% in earlier census, but in recent census, about 9% population either changed from rural to semi-urban to urban, and the habitat has changed. There's a lot more urbanization that is happening. That itself, within 3 years' time, will change these numbers. It is this transition which over a period of time is going to have more and more cancer patients. Mr. Srinivasan mentioned that there isn't a family that is not had a brush with cancer. And that's an urban phenomenon. We need to understand what is it that in urban population that can be prevented. So my talk will have how to stop before it starts. And India, as we move from developing to closer to developed countries, it's the BRICS countries that are moving towards in that direction. And India is the only country where these numbers that I rattled out just now have remained constant for the last 15 to 20 years. Unlike other countries where it has been on the rise and the numbers have gone up to maybe 200 in some of these countries. So we are better off, a bit of optimism in that. There is something even better. About two-thirds of our cancers are preventable, and all these two-thirds lend themselves very easily to early detection. So, conquest is easily doable. So, preventable, somewhere close to about 40% of these 45, 50 or 70 or 100, 40% of these are related to tobacco. Preventable in all possible ways. And we are presently in conversation with multiple ministries so that the agricultural ministry allows some kind of alternative cash crop, and over a period of time, maybe we can put up a goal that by 2030 or so, or 2040 or so, we get into zero production of tobacco. The second important thing is obesity. This is an urban phenomenon. Obesity accounts for 19 different cancers. Preventable. Very easy to tell somebody else stop smoking, very easy to tell somebody else lose weight. It's not easy. We need to do something proactively at the employer level, your workplace level. In fact, in my last 2 or 3 discussions with 2 consecutive chief ministers in Maharashtra, while the C-Link was being planned, I mentioned that why don't we have a double-decker C-Link? The upper for vehicles and the lower one having those travelators that we have at the airport, interrupted at maybe a mile. And imagine the first travelator moving at 5 kilometers an hour, a speed at which we walk on the street. Step onto it, start walking, you will walk at 10 kilometers an hour. The next travelator should move at 10, and the last should move at 15. The distance between Warsaw and Gateway of India through C-Link is 14 kilometers. Imagine you start from Warsaw, reach 14th kilometer in about 40 minutes. I don't think anybody takes less than 2.5 hours today, sitting at one place and reaching from one point to the other. All that is possible, the whole city walking like this, a way of mass transport, no pollution created. Just an example as to how do we deal with it. There are multiple ways in which it can be dealt. The third component, which accounts for about 15% of cancers, and that's infections. Infection-related cancers are on the wane. They are reducing at breakneck speed globally. Whether it is cervical cancer, penile cancer, stomach cancer, you name the cancer, and that related to infection is reducing at breakneck speed. Preventable, and there can be a cafeteria choice. Say HPV-related cancer, cervical cancer, or penile cancers. Very simply, either a vaccination that is available today, but it will have an effect about 25 years from now. Some form of personal hygiene being taught. The cervical cancer in rural pockets affects about 20 to 24 women every year per 100,000. That number in Mumbai is 7 in the last report. Why has it reduced? It was about 20, 24, 30 years ago. Availability of running water, the privacy of bathroom, these things are not there in our rural pockets. Men in majority of the villages would have a common well where they take their bath with their undergarments on. Where is the personal hygiene? You might say there are 100 other factors. And a simple example, our Muslim brethren, in that rural pocket where the incidence of cervical cancer is 20, 24, the incidence in the Muslim brethren is 5 per 100,000. It's the same in semi-urban, it's the same in rural, it's the same incidence in Middle East. I'm not trying to say that we should have circumcision for everybody, but a cafeteria choice. Something can be done to prevent these cancers. Of the cancers which are common, they need to be screened. So we have oral cancer because of the way we consume tobacco. We have breast cancer which is on the rise, and we have cervical cancer which is on the wane, but it lends itself very easily to early detection. So some form of early detection, and in the last decade, Tata Hospital has published 2 major studies wherein an intervention which costs less than 100 rupees can save 30% of lives because of either of these diseases, whether it is breast cancer or it is cervical cancer. The positive point of anything that we introduce for early detection is that the moment you start screening, the numbers start rising. So the incidence increases. And here is where these interventions do not increase the incidence. The false positivity and overdiagnosis is very little with these interventions. So a system, a healthcare system which is already stretched at its seams, we cannot be adding some numbers to it. So intervention that will do early detection, save lives up to 30%, and yet not produce overdiagnosis. 1 in 3 or 1 in 4 cancers in the Western countries are overdiagnosed as far as breast cancer is concerned. So imagine if we were to follow the same steps that have been followed in the West, we are likely to have another huge rise in cancer without the kind of benefit that we need to see. Having said that, what has government done? And that's where, with the Tata Trust as well as the Government of India, Tata Hospital has set off a plan wherein for every 5 million people, there will be a hub, and for every 2 million people, there should be a spoke. A hub will have the capability to deliver all the cancer treatment for all the cancers, whereas a spoke can treat only common cancers and also deliver the treatment that is planned in a hub. Primarily with the goal that every individual should have treatment close to home, near the doorsteps, of which about 10 hubs are already existing, functioning as far as Tata Hospital is concerned, and Tata Trust has created similar hubs and spokes in the whole of Northeast in Assam, and that itself has stemmed the number of patients who move from that state to Mumbai or to Delhi or to any of the metropolitan cities. And the problem is not just movement. If there is X amount of cost for treatment, there is 3X amount that goes in staying in Mumbai, in staying in a metropolitan area, and that becomes an extremely expensive affair. To cut the story short, there is effort to make that we create human resource, we create infrastructure, and there are 2 other steps that have been taken in, that there is a program called National Cancer Grid, a grid that looks after or has under its umbrella about 300 plus cancer centers across India, with the primary goal that we deliver uniform care across India. Imagine a patient being treated in Guwahati, walks up to Tata Hospital and hears exactly the same thing that was delivered, that was advised in Guwahati. That much of comfort, that much of ease with which the gentleman can go back and have treatment close to home. All those aspects covered, a web portal where a second opinion is available within 24 hours of uploading all the information about the patient. Patient gets back what is ideally suited for that kind of cancer. About 100,000 such opinions have been given under the banner called Navya, and that itself has reduced the numbers that can come, that need to come to cities. To summarize, we do have lower cancers, and it shouldn't so happen that we match 300 number in the next 20-25 years. If we can remain at 100, the way we have remained at 100 for the last 15 years, if we remain there and improve our outcomes, I'm sure about 5 or 6 studies published in the last 5 years from Tata Hospital have changed the way we treat cancer, with more than 30-40% reduction in deaths related to cancer. And each of these interventions do not cost more than 2,000 rupees. Proven efficacy, implementable tomorrow. That's where the implementation should be done. And finally, whatever is good in any other part of the world should be adopted so that we reduce the incidence of cancer, or finally we look at cancer as a small blip in life of a patient, with full support, not just for treatment, but also a wholesome support. And we have lots and lots of NGOs who work with us that look after every aspect of treatment for certain niche areas. And I will wind up my talk by saying, what are these niche areas? I just mentioned that there are common cancers, numbers are big, they need to be treated everywhere across the country, but there are some cancers that are uncommon. Cancer in children is one of them. Immensely curable. Those who get it, 80% can be cured, provided they take the treatment fully. Imagine some of those treatments take 3 months to 6 months of stay in a city. If I am told that go to Delhi and have treatment for 6 months, stay for 6 months, I don't think it is feasible. We have an NGO that looks after, takes over the child as soon as the child is registered. They look after all aspects of their stay, the treatment. One of the parents is given a job in Mumbai for those 6 months that they earn during that time. While this happens, we have about 40-50 teachers who spend 4 hours every day to continue the education of the child. Whether the child appears for exam or not is immaterial, but there is a continuity of education. All that covered at the end of the treatment, the child goes back to the place. I would request each one of you to visit the place where they are accommodated in Mumbai. It is a place which is spotlessly clean. Sometimes when I visit the place, I keep on telling those proprietors that I would love to come and stay here. The fallout, these children go back. We visited their houses in their villages, and we find that the houses are spick and span. The children insist that there should be cleanliness there after having gone through this for 6 months. Post that, the surroundings are also clean. Imagine what can come out of something that can happen, and we now have 2 such survivors joining our hospital as cancer specialists in Tata Hospital. It will not be an exaggeration if India is an exception, that we will have lower incidence of cancer and higher cure rates. Our mortality is already less than what the rest of the country is, but rest of the world is. But that doesn't mean we should get into complacency. We need to see that this sustained good service remains good, remains abreast with the novelty that is coming up, newer methodologies that are coming up, and at the same time introduce early detection. I have a problem, I go to a doctor till the time the problem is sorted out. When it comes to screening, there are no problems. It is an individual ostensibly normal walking on the street who needs to understand that he or she needs to visit the doctor because he or she is at a higher risk of some common cancers. This is uncommon. This doesn't happen. This doesn't have the gumption to continue doing this. We need to have that through Network 18 being disseminated on daily basis. And if it is done over a period of years, I'm sure it becomes a norm and a way of life. Thank you very much.
So I'm going to take just some more time of Dr. Barve here for a very short conversation, sir. Sir, your emphasis on making healthcare approachable for everyone, I believe is the most humane aspect of everything that you spoke of. I know of so many people around me who don't have the best of the financial resources, but want to fight this disease. What kind of public-private network we can have in this country in terms of the healthcare system to expand that grid that you were talking about, which I believe is a great vision?
So I'm sure there is so much of CSR that is available that needs to be channelized for not just cancer, but all healthcare related problems. And two components in it. One is that unlike any other business, healthcare delivery is not a business, but it needs to be run like one. I say it is not a business because the customer, I hate to call patient a customer, he's not a customer, but that customer doesn't have a choice of not having treatment. He is a captive customer. He might go from one doctor to the other doctor to the third doctor, but cannot exercise a choice which I can, of not having treatment, which I can exercise if I'm buying a car, if I'm buying a phone. I might go to 10 places and finally take a decision that I don't want to buy. So he's a captive customer, one. Second, as a service provider, I am supposed to work towards zero disease in society. I work towards my own irrelevance. I do not create disease in society, unlike I can create need in society of transportation, of telephone communication. So many needs can be created in society, but I cannot create disease in society. So for these two reasons, it's not a business. But what's being delivered, the QA/QC of that, the sustained activity of that, all that needs to be exactly the way one would run a business. So that's where I feel that we do need individuals or companies to come forward so that we have the best of the QA/QC of delivery. At the same time, the profit motive should be balanced. I don't say that there is no profit, but it can't be a huge profit the way it can happen in many other ways.
No, and I'm glad you're candidly saying that you can't completely take away the profit aspect of it. It needs to be spoken of more freely. The other aspect I want to talk to you about is the mindset. And I believe that's most important when you're fighting a disease like cancer. You must have seen thousands or lakhs of patients in your vast, illustrious career. What is one thing that sticks out when you're fighting a disease of this nature? Is it just the grit and determination that we talk about? Or these things are affected by the kind of ecosystem you have, the family support you have, the resources you have? All of them are directly correlated to the determination and the will with which you're going to fight it.
We are very fortunate that family as a system, as a unit, is extremely powerful in this country. We need to sustain that. Without that support, it is not possible for anybody to come up. And Rajneesh ji did mention that the optimism with which you tackle the disease allows you to come out of it. And I'll give you a quick example. There was a lady to whom I gave the diagnosis of breast cancer, and I could see that she couldn't take it too well. She almost broke down crying, and I said, maybe you want to sit for some time, and then once you've recovered, you can come, and then I will talk to you about what treatment can be given. So the lady walked out of the consulting room, sat there, and after 2-3 other consultations, she walked in, and she was beaming. And I was wondering what made her change, such a radical change. She was completely different by when she came back. And I asked her, I said, what happened? Did you speak to somebody? Did you read something that you felt? She said, right outside your consulting room, there is a line written that 1 out of 23 individuals get breast cancer in India. That was quite some time ago. And she said, if I have got it, 22 others are not going to get it. And I feel great about it. I mean, imagine the kind of positivity. So, and the lady still comes today. It's 20 years since. And the only way I can see is that all kinds of odds, all kinds of worst prognosis, if somebody can go through this, it's because of the will to change. And nothing else. Nobody else listens to you as much as yourself. You keep on saying those positive things, and I'm sure things will be great as far as outcomes are concerned. The Honorable Health Minister is here.
Dr. Barve, thank you.
Namaskar.
Thank you so much for that very wonderful conversation. It's always a pleasure. Ladies and gentlemen, without further ado, आज हमारे साथ एक बहुत खास शख्सियत मौजूद है। केंद्रीय स्वास्थ्य मंत्री मनसुख मंडाविया जी हमारे बीच में हैं। एक बार जोरदार तालियों के साथ उनका अभिनंदन करिए, उनका स्वागत करिए। जब सारी दुनिया कोविड-19 से जूझ रही थी, मनसुख मंडाविया जी ने इस महामारी में लड़ने के लिए एक अहम भूमिका निभाई। भारत के वैक्सीनेशन प्रोग्राम में एक बहुत अहम योगदान दिया। लगभग 70% से ज्यादा अगर आज हमारा वैक्सीनेशन रेट है, तो उसमें मनसुख मंडाविया जी जैसे नेताओं का, हमारे मंत्रियों का हाथ है, जिन्होंने आगे बढ़कर लोगों की मदद की, जरूरतमंदों की मदद की और एक सामूहिक लड़ाई की तरह हमने कोविड-19 को इस देश में हराया है। बिना और विलंब किए मैं मंडाविया जी को चाहूंगी मंच पर बुलाना फॉर अ वेरी शॉर्ट एड्रेस। लेडीज एंड जेंटलमैन, प्लीज वेलकम मिस्टर मनसुख मंडाविया, द यूनियन हेल्थ मिनिस्टर, ऑन द स्टेज।
ग्राउंड में आने के बाद तुरंत ही बैटिंग दिया गया है। आज का संजीवनी प्रोग्राम में मुझे ब्रिजेश भाई कई दिनों से बोल रहे थे कि आप जिस डेट तय करेंगे उस डेट हम कार्यक्रम करेंगे, और इस बार हम इस श्रेणी में कैंसर पर कार्यक्रम करना चाहते हैं। मैंने कहा था कि वेडनेसडे रखना, उस दिन कैबिनेट होती है तो मैं दिल्ली में रहूंगा और कोशिश करूंगा कि मैं आ सकूं। दोस्तों, हेल्थ एक ऐसा सब्जेक्ट है जिस सब्जेक्ट पर डिस्कशन और डेलिब्रेशन कंटिन्यूस चलता रहता है। समय के साथ डिसीज की पैटर्न भी बदलती रहती है, लोगों की लाइफस्टाइल भी बदलती रहती है। हेल्थ सेक्टर में जो स्थिति आज है वो कल ना भी हो सकती है, कल है वो परसों नहीं होती है। ऐसी स्थिति में देश में हेल्थ सेक्टर में होलिस्टिक अप्रोच के साथ काम करने की आवश्यकता होती है। हेल्थ है कभी पॉलिटिकल सब्जेक्ट नहीं होना चाहिए, और हेल्थ पॉलिटिकल सोच के साथ, फॉर एग्जाम्पल एज ए मिनिस्टर कोई मुझे आके कहे कि मंत्री जी मेरे यहां मेरी कॉन्स्टिट्यूएंसी में एक डिस्पेंसरी खोल दो, तो मैं टोकन सोचूं तो एक डिस्पेंसरी खोल दूं। ट्रेडिशन वही थी, लेकिन ये ट्रेडिशन से बाहर आके हेल्थ को डेवलपमेंट के साथ जोड़ने के लिए 2014 से शुरुआत हुई। टोकन में नहीं, टोटल अप्रोच के साथ हेल्थ को देखा गया। नहीं केवल डिस्पेंसरी खोलना, लेकिन देश में हेल्थ एक्सेसिबल कैसे हो, हेल्थ अफोर्डेबल कैसे हो। दोस्तों, दुनिया के हर देश को अपना अपना हेल्थ का मॉडल हो सकता है, लेकिन हमारी कंट्री, हमारी स्थिति के अनुसार हेल्थ का मॉडल हमारा हमारा हो सकता है। और हमारा मॉडल कैसा होना चाहिए, इंडियन हेल्थ मॉडल कैसा होना चाहिए? दोस्तों, मैं मानता हूं कि मोदी जी ने 15 अगस्त 2022 में जब आजादी का अमृत वर्ष में रेड फोर्ट से देश को एड्रेस कर रहे थे, उस वक्त मोदी जी ने एक विचार रखा कि जब देश आजादी का शताब्दी वर्ष मनाता हो, उस वक्त हमारा देश डेवलप्ड कंट्री होना चाहिए। 25 साल का समय ये हमारा अमृत काल है। ये अमृत काल में हमें हमारा पाथवे तैयार करना है, उसके पर चल के हमें आगे जाना है। तो पाथवे कैसा होना चाहिए, उसका मॉडल क्या क्या होना चाहिए, उसके लिए मोदी जी ने 5 प्राण की बात की थी। पहले कहा कि हमें डेवलप्ड कंट्री बनना है। दूसरा प्रण बताते हुए कहा कि हमें गुलामी की सारी मानसिकता से, गुलामी के चिन्ह से मुक्ति पानी है। तीसरी बात उन्होंने कहा कि हमें विरासत से प्रेरणा लेनी है। चौथी बात कहा कि देश को एकजुट होकर आगे बढ़ना है, यानी कि इंडिविजुअल कोई व्यक्ति एक स्टेप आगे बढ़ता है तो केवल एक स्टेप ही व्यक्ति आगे बढ़ के रुक जाता है, लेकिन देश की 140 करोड़ की जनसंख्या एक सोच, एक कमिटमेंट के साथ, एक विचार के साथ एक स्टेप आगे बढ़ती है तो देश 140 करोड़ स्टेप एक साथ में आगे बढ़ जाता है। मोदी जी ने कहा कि एक गोल को अचीव करने के लिए देश के हर नागरिक की जिम्मेवारी होनी चाहिए, और ये नागरिक अपनी जिम्मेवारी को कैसे अदा करे? तो मोदी जी ने कहा कि हम कर्तव्य भाव से, 5वें प्रण में कहा कि हम कर्तव्य परायणता से व्यवहार करेंगे, यानी कि हर नागरिक अपना कर्तव्य को समझे। व्हाट इज माय ड्यूटी? हर नागरिक की नेशन के प्रति जिम्मेवारी है, इस जिम्मेवारी को वहन करे। और इस विषय से प्रेरणा लेते हुए हेल्थ सेक्टर में हमें हमारी विरासत से प्रेरणा लेना है। दोस्तों, हमारी विरासत हमें हमारा हेल्थ का मॉडल दिखाती है। दुनिया के लिए हेल्थ एक कॉमर्स हो सकता है, लेकिन इंडिया के लिए हेल्थ एक कॉमर्स नहीं है। इंडिया के लिए हेल्थ एक सेवा है। जब देश के नागरिक को आप सेवा के लिए हेल्थ सेक्टर में प्रेरित करेंगे तो देश के नागरिक उसमें बढ़ चढ़ के रुचि लेंगे। हमने कोविड क्राइसिस के दरमियान देखा, और उसमें देश का हेल्थ का मॉडल का इंप्लीमेंटेशन किया गया। जब देश में लॉकडाउन चल रहा था, दुनिया में लॉकडाउन चल रहा था, दुनिया के साथ मेरी मीटिंग होती थी, दुनिया के हेल्थ मिनिस्टर से मेरा डायलॉग होता था। उस वक्त डेवलप्ड कंट्री के कई हेल्थ मिनिस्टर मुझे कहते थे कि व्हाट इज सिचुएशंस इन योर कंट्री। वो मुझे बताते थे कि हमारे यहां डॉक्टर ड्यूटी पर नहीं आ रहा है, नर्स ड्यूटी पर नहीं आ रही है, हमारे अस्पताल में पेशेंट है, डॉक्टर नहीं है। आपके यहां कैसा है? तब मैं कहता था कि हमारे यहां डॉक्टर भी ड्यूटी पर आते हैं, नर्स भी ड्यूटी पर आते हैं। कई लोगों ने, कई नर्स ने, कई डॉक्टर्स ने, कई पैरामेडिक स्टाफ्स ने, कई कोरोना वॉरियर्स ने अपने जान को गंवा दिया। उस वक्त सोशल मीडिया पर एक वीडियो वायरल हुआ था। एक मां नर्स थी, कोविड वार्ड में ड्यूटी दे रही थी। 3 महीने की उसकी बच्ची अपने घर पे थी, पिताजी उसकी संभाल कर रहे थे। मां को डर लग रहा था कि मैं कोविड वार्ड में ड्यूटी कर रही हूं, मैं जाऊंगा, मेरी बच्ची को कोविड शायद लग जाए। वो व्हाट्सएप वीडियो से बच्ची का मुंह देख लेती थी, आंख में से आंसू बहा लेती थी, लेकिन उन्होंने अपनी ड्यूटी नहीं छोड़ी, क्योंकि इंडिया का मॉडल है सेवा, ये हमारा धर्म है, सेवा ये हमारा व्यवहार है। हेल्थ सेक्टर के लिए हर व्यक्ति उस वक्त चाहते थे कि मैं भी मदद करूं। देखो, जब लॉकडाउन में डेवलप्ड कंट्री में भी लॉकडाउन के सामने एजिटेशन हो रहा था, बड़ी दिक्कत वाली स्थिति हो गई थी। ब्रेड के लिए 4 व्हील गाड़ी की लंबी लाइन लगी थी, लेकिन मोदी जी ने उस वक्त देश को संबोधित करते हुए अपनी कर्तव्य पारायणता के बारे में बात कही, अपनी विरासत के बारे में बात कही। हमारा कोरोना वॉरियर्स, हमारा मेडिकल स्टाफ, पैरामेडिकल स्टाफ, उसका हौसला बढ़ाया। उसके लिए ट्राई कलर हवाई जहाज के द्वारा फहरा के उसको अभिनंदन किया। सारे देश के 140 करोड़ की जनसंख्या रोड पे आई, ताली बजाई, थाली बजाई, हमारा कोरोना वॉरियर्स के लिए सम्मान दिया और हमारी टीम काम पे लगी। दोस्तों, दुनिया को ऐसा था कि शायद इंडिया कोविड क्राइसिस के सामने लड़ नहीं पाएगा, लेकिन मैं लास्ट जनवरी महीने में वर्ल्ड इकोनॉमिक फोरम में भारत का नेतृत्व करते हुए, डेलीगेशन को लीड करते हुए गया। बिल गेट्स के साथ मेरी मीटिंग थी। हम भारतीय हैं, हमें कोई मिलने के लिए आते हैं तो खड़ा होते हैं, गेट तक उसको लेने के लिए जाते हैं। मैं भी बिल गेट्स को मेरे कमरे में खड़ा होकर उसको लेने के लिए गया। उन्होंने मेरे से हैंडशेक किया और उसका पहला सेंटेंस था, कांग्रेचुलेट इंडिया, यू हैव डन गुड कोविड मैनेजमेंट एंड वैक्सीनेशन ड्राइव। हम कर सकते हैं, हमारा मॉडल ने हमें मदद किया। हमारा ये भी मॉडल है। दोस्तों, कोविड क्राइसिस के दरमियान दुनिया के पास मेडिसिन नहीं थी। हाइड्रोक्सीक्लोरोक्विन, एजिथ्रोमाइसिन की क्राइसिस थी और उस वक्त सारे दुनिया में लॉकडाउन था। इंडिया में नेशनल इंटरनेशनल फ्लाइट, कॉमर्शियल फ्लाइट ऑपरेट नहीं हो रही थी, लेकिन उस वक्त डेली 4 से 5 फ्लाइट इंडिया में लैंड होती थी मेडिसिन लेने के लिए। 150 देश में हिंदुस्तान ने मेडिसिन सप्लाई की पहुंचाई। जिस वक्त दुनिया वैक्सीन का स्टॉक पाइलिंग कर रही थी, वैक्सीन मैन्युफैक्चरिंग कंट्री 2-3 थी और स्टॉक पाइलिंग कर रहे थे, तब हम वैक्सीन मैत्री के तहत हमारे पड़ोसी देश और नीडी कंट्री के लिए वैक्सीन प्रोवाइड कर रहे थे। इस सारी प्रक्रिया के दरमियान हमने, उस वक्त हम चाहते तो मेडिसिन का प्राइस हम चाहे वो ले सकते थे। वैक्सीन की प्राइस उस वक्त $15-17, $19, $20 की वैक्सीन थी। हमारे यहां $2.5, $3 में हम दुनिया को दे रहे थे। हम चाहते तो उसकी प्राइस बढ़ा सकते थे, लेकिन हमने नहीं किया। हेल्थ इज नॉट कॉमर्स टू अस। हमारे लिए हेल्थ एक कॉमर्स नहीं, सेवा है। और दुनिया को 150 कंट्री में हमने जब मेडिसिन पहुंचाई पोस्ट कोविड के बाद, आज दुनिया चाहती है कि इंडिया एक एकलौती कंट्री है जो क्राइसिस की स्थिति में भी हमारे साथ रहती है, हमारी दोस्ती निभाती है, हमें मदद करती है। उसके लिए इंडिया प्रायोरिटी कंट्री बन गया है। और इसलिए हिंदुस्तान ने हेल्थ सेक्टर में अपने विरासत से प्रेरणा लेके आने वाले दिनों में होलिस्टिक अप्रोच के साथ सर्वग्राही दृष्टि से हेल्थ को एफोर्डेबल और एक्सेसिबल कैसे हो, उसके लिए कार्यक्रम चलाया। आयुष्मान योजना के 4 पिलर से हमने एक ऐसा रोड मैप तैयार किया कि कोई भी देश को डेवलप्ड कंट्री बनना है, बेस्ट इंफ्रास्ट्रक्चर होना चाहिए, कंट्री में गुड गवर्नेंस होना चाहिए, कंट्री में सिटीजन नागरिक हेल्दी होना चाहिए, बेस्ट हेल्थ सिस्टम होना चाहिए। इस सारी व्यवस्था को पूरी करने के लिए हमने आयुष्मान भारत योजना चलाई। 4 पिलर उसके लिए तय किया। आयुष्मान भारत हेल्थ एंड वेलनेस सेंटर, देश में 1,60,000 से अधिक हेल्थ एंड वेलनेस सेंटर हमने बनाया। और हेल्थ एंड वेलनेस सेंटर में 13 टाइप की स्क्रीनिंग होता है। आपने यहां कहा कि वर्तमान समय में आप डिस्कशन करेंगे, डिबेट करेंगे कैंसर की सिचुएशंस पर। आपकी थीम इस बार कैंसर पर है। दोस्तों, 3 टाइप के कैंसर, सर्वाइकल कैंसर, ओरल कैंसर, ब्रेस्ट कैंसर, हमारी 10 लाख आशा बहन को हमने एम्पावर किया है, उसको ट्रेन किया है। वो घर घर जाती है। 1000 पॉपुलेशन पर 1 आशा बहन घर घर जाके घूमती है। प्राइमरी सिम्टम उसको पता चलता है। आशा बहन एक ऐसा हेल्थ वर्कफोर्स है, मैं दुनिया में बात रखता हूं और यूनाइटेड वर्ल्ड हेल्थ असेंबली में हमारी आशा बहन की इंडियन हेल्थ सेक्टर में जो भूमिका हो उसकी प्रशंसा करते हुए उसको सम्मानित किया गया। 1000 पॉपुलेशन में कौन सी महिला को कौन सी फैमिली में किस टाइप का डिसीज है, सारी इंफॉर्मेशन उसके पास होती है। कौन से बच्चे को टीका लगा हुआ है, कौन मां प्रेग्नेंट है, सारी इंफॉर्मेशन उसके पास होती है। वो घर में जब जाते हैं विजिट पर, तब उसके साथ बातचीत में उसको पता चलता है कि वो कैंसर हो सकता है। तुरंत ही हेल्थ एंड वेलनेस सेंटर पर लाके उसकी स्क्रीनिंग हो जाती है और स्क्रीनिंग करके और शायद वो पॉजिटिव हुआ तो डिस्ट्रिक्ट लेवल पर मेडिकल कॉलेज हो, डिस्ट्रिक्ट हॉस्पिटल हो, वहां उसका उपचार हो जाता है। उपचार करने के लिए शायद वो फाइनेंशियली स्ट्रांग ना हो। देश में 60 करोड़ लोगों को आयुष्मान भारत योजना के लाभार्थी की सूची में शामिल किया गया है। वहां उसको मुफ्त इलाज मिल जाता है। 42 से अधिक कैंसर की मेडिसिन में, दुनिया में कहां भी जाओ सबसे सस्ती कैंसर की मेडिसिन इस देश में मिलती है, तो ये देश का नाम इंडिया है। कुल मिला के 90 टाइप की मेडिसिन कैंसर के लिए होती है। इतनी ही होती है ना डॉक्टर साहब, बड़वे साहब को पता होगा। उसमें से 42 कैंसर की मेडिसिन के लिए हमने ट्रेड मार्जिन फिक्स कर दिया है। उसमें कोई मुनाफाखोरी नहीं कर पाएंगे। और ये कैंसर की मेडिसिन जेनरिक वर्जन देश में 10,000 से अधिक जनऔषधि केंद्र है, वहां पर उपलब्ध हो जाता है। लोगों को सस्ता इलाज मिले, टाइम पे उसका स्क्रीनिंग हो जाए, उसको ट्रीटमेंट मिले। हमारे आईसीएमआर के रिपोर्ट के मुताबिक प्रतिवर्ष 14 लाख नए कैंसर के पेशेंट शामिल होते हैं। उसको बेस्ट इलाज मिले, उसके लिए कैंसर हॉस्पिटल भी बढ़ाई जा रही है। टर्शरी केयर फैसिलिटी भी डेवलप हो रही है। 22 जितनी एम्स बन रही है, ताकि डिस्ट्रिक्ट हॉस्पिटल से कोई पेशेंट को और रिफर करने की आवश्यकता हो तो वहां भी उसको इलाज मिल जाए। कुल मिला के एक होलिस्टिक अप्रोच के साथ हेल्थ सेक्टर में हम आगे बढ़ रहे हैं। हमने केवल 1,60,000 हेल्थ एंड वेलनेस सेंटर खोल दिया, तो काम पूरा नहीं होगा। वहां डॉक्टर चाहिए तो एमबीबीएस की सीट बढ़ानी चाहिए। एमबीबीएस की सीट डबल कर दिया, पीजी की सीट डबल कर दिया। 9 साल में मेडिकल कॉलेज डबल हो गए। हमारे स्टूडेंट को विदेश पढ़ने के लिए जाना पड़ता है। देश में उसको क्वालिटी एजुकेशन मिले, उसके लिए देश में व्यवस्थाएं खड़ी की जा रही है। हेल्थ एंड वेलनेस सेंटर के बाद आयुष्मान भारत हेल्थ इंफ्रास्ट्रक्चर मिशन। दोस्तों, हेल्थ सेक्टर में कभी हमें सेटिस्फैक्शन लेवल पे नहीं पहुंचना है। नया नया रिसर्च हो, नया नया इनोवेशन हो, उसके लिए हमने लास्ट वीक में कल ही फार्मा सेक्टर की रिसर्च पॉलिसी को लॉन्च किया और उसके लिए इंसेंटिव स्कीम को कल ही मैंने लॉन्च किया है। मैं जानता और समझता हूं कि हमारे यहां हेल्थ को अफोर्डेबल करने के लिए मेडिसिन सस्ती मिले, हम एनएलएम का लिस्ट तैयार करते हैं। हम हमारी कंपनी को प्रॉफिटेबल ज्यादा मुनाफा कमाने से रोकते हैं, तो वो अपना इन्वेस्टमेंट रिसर्च के पीछे कम कर पाता है, स्वाभाविक है। आज मल्टीनेशनल कंपनी अपने प्रॉफिट का 20-25% रिसर्च और इनोवेशन के पीछे खर्च करता है। हम आज फार्मेसी ऑफ द वर्ल्ड है, लेकिन फार्मेसी ऑफ द वर्ल्ड जेनरिक में है। आज हम कंटेनर में मेडिसिन एक्सपोर्ट करते हैं, लेकिन कंटेनर में हम जब एक्सपोर्ट करते हैं तब लाखों में इनकम होती है, लाखों में पैसा आता है, कि उसकी कीमत लाखों में होती है। बट हम जब इंपोर्ट करने के लिए जाते हैं, इनोवेटिव ड्रग्स इंपोर्ट करने के लिए, पेटेंट ड्रग्स इंपोर्ट करते हैं। आज मस्कुलर डिस्ट्रोफी के केस में मेरे सामने आया कि एक कोर्स का 16 करोड़ रुपया की कीमत है। हम कितना कंटेनर भर भर के भेजे, लिफाफे में आएगी और उसका 16 करोड़ देना पड़ता है। क्या ये रिसर्च और इनोवेशन हम इंडिया में नहीं कर सकते क्या? दोस्तों, ये देश में ब्रेन पावर और मैन पावर की कभी कमी नहीं थी। सवाल इतना ही है कि उसको अपॉर्चुनिटी मिले, उसको प्रोत्साहित किया जाए, उसके लिए इकोसिस्टम क्रिएट की जाए। मैंने एक घटना देखी है और आप में से जो डॉक्टर है उसको भली भांति पता होगा, वैक्सीन का रिसर्च होना वो दुनिया में ही होता है, हम तो वहां से लाके यहां मैन्युफैक्चरिंग कर लेते हैं, बाकी रिसर्च पेटेंट तो दुनिया की ही होती है, ऐसा माइंडसेट था हमारा। और दुनिया में वैक्सीन का रिसर्च होने के बाद सामान्यतः 8 साल, 9 साल, 10 साल, 15 साल, चाहे वो पोलियो के वैक्सीन हो, स्मॉल पॉक्स की वैक्सीन हो, रूबेला के वैक्सीन हो, इतने लेट समय में इंडिया में आती है। लॉकडाउन चल रहा था, वैक्सीन कोविड के सामने हम कैसे लड़ेंगे, जब मोदी जी ने हमारी साइंटिस्ट कम्युनिटी के साथ मीटिंग रखी थी और मीटिंग में मोदी जी ने कहा कि ये कोविड के सामने हम कैसे लड़ेंगे, तब हमारा साइंटिस्ट ने कहा कि साहब वो अननोन वायरस है, म्यूटेट होके क्या बिहेवियर करेगा ना हमें पता है, ना दुनिया के कोई साइंटिस्ट को पता है, लेकिन उसका एक उपाय हो सकता है, उसका वैक्सीन हम बनाए। और उस वक्त मोदी जी ने कहा था कि मुझे मेरे साइंटिस्ट पर भरोसा है, आप मेहनत करो वैक्सीन रिसर्च में, निष्फलता मेरी, सफलता आपकी। हमारे ही साइंटिस्ट ने वैक्सीन का रिसर्च कर लिया। दुनिया में फर्स्ट डोज शायद 20 दिसंबर 2020 में लगा था। उसके बाद एक महीने में 17 जनवरी 2021 में इंडियन रिसर्च, इंडिया में मैन्युफैक्चरिंग किया हुआ इंडिजिनियस वैक्सीन का डोज इंडिया में एडमिनिस्टर हो गया था। दोस्तों, एक ही महीना में, दुनिया के पीछे केवल एक महीने में हमने एक गोल को अचीव कर लिया था। एक क्षमता हमारी है, सवाल है हम इकोसिस्टम बनाए। सवाल इतना ही है कि हम रिसर्च इनोवेशन के पीछे माइंड अप्लाई करें। हम कर सकते हैं, कॉन्फिडेंस बिल्ड करें। दोस्तों, जब चंद्रयान लैंड किया चंद्र पर, मेरे आईसीएमआर के साइंटिस्ट मुझे मिलने आए। उन्होंने कहा कि वो चंद्रयान वहां लैंड कर सकता है, हम हमारे सेक्टर में 2-3 प्रपोजल लेके आ गए। उसका कॉन्फिडेंस बिल्ड हुआ, उसका हौसला बढ़ा कि हम भी एक गोल पर काम करना चाहते हैं और उसको टाइम में अचीव करना चाहते हैं। हम कर सकते हैं, हमारी क्षमता में कोई कमी नहीं है, और इसलिए हमने उसके लिए एक इकोसिस्टम तैयार करने की कोशिश की। और इसलिए मोदी जी ने कहा, जय जवान जय किसान, जब विज्ञान के साथ जय अनुसंधान को जोड़ा। ये समय की मांग है, दुनिया हमसे अपेक्षा रख रही है कि इंडिया लीड करे, इंडिया में रिसर्च हो, इंडिया में इनोवेशन हो। इंडिया आज दुनिया के लिए प्रायोरिटी है, खास करके ग्लोबल साउथ के लिए इंडिया प्रायोरिटी है। दोस्तों, ऐसी स्थिति में हम हेल्थ सेक्टर में वर्तमान समय की समस्या, वर्तमान समय के इश्यू को एड्रेस करके, आज नॉन कम्युनिकेबल डिसीज हमारे सामने एक बहुत बड़ी चैलेंज है। समय के साथ हमारी वर्किंग बिहेवियर बदला है, हमारी लाइफस्टाइल बदली है। हम आज श्रम से हटे हैं। ये सब स्थिति को देखते हुए हम एक न्यू आइडिया से कैसे काम करें, वेलनेस पर कैसे काम करें, कैंसर पेशेंट को ट्रीट करें, इट्स ओके, करना चाहिए। ट्रीटमेंट के लिए इनोवेशन हो, मेडिसिन के लिए इनोवेशन हो, होना चाहिए, लेकिन हम हमारे वेलनेस के लिए एफर्ट कर सकते हैं क्या? वेलनेस पर भार देके, हमारी जीवन शैली और खान पान में बदल करके, हम एनवायरमेंटल इश्यू को रिजोल्व करके, हम केमिकल्स और फर्टिलाइजर का यूज को कम करके असाध्य रोग के सामने लड़ सकते हैं क्या? नॉन कम्युनिकेबल डिसीज के सामने लड़ सकते हैं क्या? मैं भारत सरकार का फार्मा मिनिस्टर भी हूं, केमिकल्स मिनिस्टर भी हूं, फर्टिलाइजर मिनिस्टर भी हूं और हेल्थ मिनिस्टर भी हूं। तो सारा विषय को ज्वाइंट करके मैं जब सोचता हूं तब कई आइडियाज आता है दोस्तों, विजन मिलता है। कई टास्क मैं एम्स को देता हूं कि उसके पर आप अध्ययन करिए, उसके पर आप काम करिए। कई टास्क मैं कैंसर इंस्टीट्यूट को देता हूं। कई टास्क मैं नाइपर जैसी इंस्टीट्यूट को देता हूं, इनोवेशन के लिए, रिसर्च के लिए काम करने वाली गवर्नमेंट इंस्टीट्यूट के लिए करता हूं। दोस्तों, एक होलिस्टिक अप्रोच के साथ वन हेल्थ फैसिलिटी क्रिएट करके रिसर्च पर हम ओपन माइंड से, जब मैं एक बार हैदराबाद गया और हैदराबाद में वन हेल्थ फैसिलिटी का मेरे हाथों से इनॉग्रेशन था, तो मैंने इनॉग्रेशन करने के बाद मेरी टीम के साथ बैठा था, तो मैंने कहा कि आप वर्ल्ड क्लास की इतनी बड़ी इंस्टीट्यूट खड़ी कर दी है और उसके पार रिसर्च कौन करेगा? तो उन्होंने कहा कि आईसीएमआर करेगा, डीबीटी वाले करेंगे। तो मैंने कहा आईसीएमआर और डीबीटी के लिए हो मर्यादित क्यों हो? क्यों हम प्राइवेट सेक्टर के लिए ओपन नहीं कर सकते हैं? मैं इंडस्ट्रीज के लिए ओपन नहीं कर सकता? मेरे कोई साइंटिस्ट, एंटरप्रेन्योर्स वहां आके कोई रिसर्च करना चाहे तो नहीं कर सकते हैं? मैंने कहा कि वो सभी के लिए ओपन होना चाहिए और 2 महीने में ही बजट में मैंने अनाउंसमेंट करवा दिया। आज हमारी वन हेल्थ की फैसिलिटी, हमारी रिसर्च इंस्टीट्यूट नहीं केवल गवर्नमेंट सेक्टर के लिए, प्राइवेट सेक्टर के लिए भी ओपन है, ताकि वहां रिसर्च और इनोवेशन के लिए अपॉर्चुनिटी मिले। दोस्तों, बदलते समय में हमें हमारे लक्ष्य की ओर आगे बढ़ना है। जब देश आजादी का शताब्दी वर्ष मनाता हो, तब हमें डेवलप्ड कंट्री के रूप में दुनिया के सामने आना है। और जब डेवलप्ड कंट्री के रूप में हिंदुस्तान आगे बढ़ रहा है, तब डिटेल वर्कआउट हुआ है। जब कोविड क्राइसिस के दरमियान हम सब लोग लॉकडाउन में थे, लेकिन मोदी जी ने हम लोगों को सोने नहीं दिया था। हमारे पास वो एक्सरसाइज कराते थे, 25 साल का रोड मैप तैयार करो। सरकार कोई भी हो, 25 साल का रोड मैप तय हो, यही रोड मैप पे आगे बढ़ के हम देश को हेल्थ सेक्टर में ऑल टाइप ऑफ फैसिलिटी, यानी कि हम डेवलप्ड कंट्री की बराबरी में ले जा सकते हैं। क्या हो सकता है उसका रोड मैप? सभी भारत सरकार की मिनिस्ट्री ने अपने अपने डिपार्टमेंट का, अपनी अपनी मिनिस्ट्री का रोड मैप बनाया है। हेल्थ सेक्टर ने भी अपना रोड मैप बनाया है। ये रोड मैप पर चलते हुए आज हम 1-1-2-1-2-1-2-1 डिसीजन लेते हुए आगे बढ़ रहे हैं। आने वाले दिनों में आज क्या करना है, 5 साल के बाद क्या करना है, 10 साल के बाद क्या करना है, आज चैलेंज क्या है, 5 साल बाद की चैलेंज क्या होगी, 10 साल के बाद की चैलेंज क्या होगी, 25 साल के बाद की चैलेंज क्या होगी, उसको हमें आज से एड्रेस करना होगा। तब जाके हम डेवलप्ड कंट्री बन पाएंगे। और दोस्तों, समृद्ध राष्ट्र बनाने में देश के नागरिक का स्वास्थ्य बहुत अहम भूमिका रखता है। स्वस्थ नागरिक, स्वस्थ सिटीजन, स्वस्थ समाज का निर्माण करता है। स्वस्थ समाज समृद्ध राष्ट्र का निर्माण करता है। और इसलिए मैं मानता हूं कि आपकी संजीवनी प्रोग्राम, ये प्रोग्राम से डिस्कशन होगा, डेलिब्रेशन होगा, क्वेश्चंस आंसर्स होगा, उसमें से कुछ अमृत निकलेगा। और आपका डिस्कशन, डेलिब्रेशन के आधार पर जो भी आउटपुट निकले, मेरी रिक्वेस्ट है कि उसकी एक नोट तैयार करके मुझे भेज देना, ताकि जनता से क्या निकल रहा है। जो सरकार ऑफिस में बैठ के डिसीजन लेने लगती है, तब हम सही दिशा में आगे नहीं बढ़ सकते। मोदी गवर्नमेंट स्टेक होल्डर कंसल्टेशन में मानती है, डिस्कशन में मानती है, डेलिब्रेशन में मानती है, ताकि सही चीजें हमारे संज्ञान में होनी चाहिए जब हम पॉलिसी डिसीजन करने के लिए बैठे। मेरी अपेक्षा है कि आपका डिस्कशन, डेलिब्रेशन मेरी मिनिस्ट्री के लिए भी उपयोगी हो सकता है। कई बार कई छोटे व्यक्ति का सुझाव, कोई छोटी बात बहुत बड़ा नतीजा लेके आ जाती है। बारिश तो बिंदु में होती है, लेकिन समुद्र को भर देती है। एक एक ईंट लगते हैं लेकिन बड़ा महल बन जाता है। उसमें यूज होने वाली छोटी छोटी चीजें जब स्वरूप में आती है, आकार बन जाती है। मैं मानता हूं कि आपका ऐसा सुझाव हमें अवश्य उपयोगी होगा। आप सबको मेरी ओर से हार्दिक शुभकामनाएं। धन्यवाद।
Ladies and gentlemen, he's got a flight to catch, so we're going to keep it very short. And मनसुख मांडविया जी, बहुत बहुत धन्यवाद, आभार आपका। देखिए, न्यूज़ 18 की तो ये पहल है जो हमारे बहुत करीब है, लेकिन अगर फेडरल बैंक, श्याम श्रीनिवासन जी हैं, टाटा ट्रस्ट से सिद्धार्थ शर्मा जी हैं, नोवार्टिस हमारे साथ जुड़ा है, अगर ये सब नहीं जुड़ते तो शायद ये मुहिम जिस पहल और जिस लेवल पर हम करना चाहते हैं वो नहीं कर पाते। आपको क्या लगता है कि और लोगों को भी ऐसे कॉजेस से जुड़ना चाहिए?
अवश्य जुड़ना चाहिए। मैं मानता हूं कि ये केवल इवेंट नहीं है, ये इट इज वन पार्ट ऑफ नेशनल एजेंडा। ये देश के एजेंडा का एक पार्ट है। मैंने मेरी बात में बताया कि हमें देश के प्रति सभी का, हर नागरिक का कर्तव्य है। यहां कोई अच्छा सुझाव दे देंगे, मैं मानता हूं कि उन्होंने कर्तव्य का पालन किया है। यहां कोई हमारी कमियां को दिखा के उजागर करके हमारे सामने लाएंगे, मैं मानता हूं कि उन्होंने अपना कर्तव्य का पालन किया है। देश हम सबका है। स्वास्थ्य ये शायद व्यवस्था की दृष्टि से सरकार की जिम्मेवारी होगी, लेकिन उसमें सहयोगी होना हम सबकी जिम्मेवारी है। और इस साझा जिम्मेवारी से ही हम कोविड क्राइसिस के सामने लड़ पाए। आपने देखा होगा, कोविड क्राइसिस के दरमियान हर व्यवस्था के साथ जनता को जोड़ी और काम जनता ने किया, आउटपुट देश को मिला।
बहुत सही कहा आपने। मंत्री जी, श्याम श्रीनिवासन जी थोड़ी देर पहले जब मंच पर आए तो उन्होंने कहा हमारा इस कैंपेन का ध्येय ही टेस्टिंग और डिटेक्शन है, कि अवेयरनेस बढ़ाएं कि आप कैंसर के लिए टेस्टिंग करिए और डिटेक्शन करिए। उनकी एक ड्रीम है कि वो एक ऐसा एआई रूपी कुछ यंत्र बनाना चाहते हैं जो रूरल लेवल पर डिटेक्शन में मदद करे। आपको लगता है कि किसी तरह से ये मुहिम सरकार के साथ जुड़कर रूरल लेवल पर, गांव में, जहां पर डिटेक्शन और ट्रैकिंग में मदद कर सकती है?
अवश्य कर सकते हैं। और देखो, आज जो मैंने आपको इंडिया के हेल्थ मॉडल की बात की, हमारा मॉडल दुनिया के मॉडल से कैसे अलग है। एक बार एक बहुत बड़ी फार्मा कंपनी, मल्टीनेशनल कंपनी के सीईओ इंडियन थे। वो मुझे मिलने आए और उन्होंने मुझे कहा कि मंत्री जी, आपके हमारे कंट्री में, इंडिया में, वो मल्टीनेशनल कंपनी के सीईओ थे, वो आए थे यहाँ। तो उन्होंने मुझे कहा कि हमारा जीडीपी का 1.5% खर्च ही हेल्थ के पीछे होता है। उन्होंने कहा कि यूएसए में 6% होता है, इटली में 7% होता है, ब्रिटेन में इतने परसेंट होता है। उन्होंने अपने 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 परसेंटेज की बात कही और उन्होंने कहा कि इंडिया ने भी अपने जीडीपी का खर्च हेल्थ के पीछे बढ़ाना चाहिए। तो मैंने उसको रिप्लाई देते हुए कहा कि हमने हेल्थ पॉलिसी बनाई है और हमने लक्ष्य रखा है कि हम 10 साल में, 5 साल चले गए, 5 साल में और 5 साल में हम उसको 2.5% तक ले जाएंगे और आगे भविष्य में हम उसके ऊपर काम करते जाएंगे। और बाद में मैंने उसको कहा कि उसका 7% होगा, किसी का 6% होगा। वहां का मॉडल और इंडिया का मॉडल में फर्क है। फर्क ये है, आज इंडिया में कोई डिस्ट्रिक्ट ऐसा नहीं होगा, कोई टाउन ऐसा नहीं होगा, कोई सिटी ऐसा नहीं होगा जहां चैरिटी से चलने वाली अस्पताल ना हो। हमारी सोसाइटी हेल्थ के लिए जिम्मेवारी उठाती है। अरे हमारे यहां एम्स या तो बड़ी बड़ी इंस्टीट्यूट में, टाटा इंस्टीट्यूट का नाम इतना बड़ा बना हुआ है, वहां से कोई बड़वे साहब कल प्राइवेट प्रैक्टिस चालू कर दे और एक कंसल्टेशन का वो 10,000 फीस रखे तो 10,000 फीस देके उसके पास पेशेंट आएगा। लेकिन मैंने ऐसे कई डॉक्टर देखे हैं, वो बड़े इंस्टीट्यूट में बड़ा नाम होने के बाद भी वो इंस्टीट्यूट छोड़ी हो और बाद में 100 रुपीज में अपनी सेवा देते हो, 100 रुपीज में कंसल्टिंग चार्ज देते, ये भी टोकन के रूप में। ऐसी कई हॉस्पिटल में वो जाएंगे फ्री अपनी सेवाएं देने के लिए। ये हमारा मॉडल है, इसलिए यहां हेल्थ केयर अफोर्डेबल है। आधा खर्च सरकार के सापेक्ष में हमारी जनता ही उठा लेती है। चैरिटी हॉस्पिटल, एनजीओ के द्वारा चलने वाले हॉस्पिटल, कोई फैमिली ट्रस्ट बना के अस्पताल चलाते हैं। अरे कोई हॉस्पिटल में, प्राइवेट हो या गवर्नमेंट हो, देखना सीएसआर फंड आज अच्छी तरह से यूज करने वाले लोगों को सीएसआर फंड बहुत उदारता से मिल रहा है। ये हमारा मॉडल है। इसलिए पब्लिक पार्टनरशिप हेल्थ सेक्टर में ये हमारा नेचर में है, हमारा स्वभाव में है। और मैं मानता हूं कि किसी के पास भी ऐसा पब्लिक पार्टनरशिप का मॉडल हो। मैं एक सामान्य एग्जांपल दूं आपको। जब लास्ट प्रधानमंत्री जी के जन्मदिन के अवसर पर मैंने केवल आह्वान किया था, एक सभी इंडस्ट्रीज के साथ, जनप्रतिनिधियों के साथ एक मीटिंग की, और मैंने कहा कि मोदी जी ने कहा है कि हम 2025 अंत तक देश को टीबी मुक्त करना चाहते हैं। क्या हम निक्षय मित्र बने और टीबी पेशेंट को गोद ले? और उसके लिए मैंने एक डिजिटल प्लेटफॉर्म लॉन्च किया। मुझे बताते हुए खुशी हो रही है कि केवल 15 दिन में 1 लाख से अधिक लोग निक्षय मित्र बन के 12 लाख पेशेंट को गोद ले लिया। और उसको रेगुलर फोटो भेजते हैं, कार्यक्रम में सोशल मीडिया में ट्रैक करता हूं तो पता चलता है रेगुलर 1000 रुपए की न्यूट्रिएंट फूड की किट उसको पहुंचाते हैं। ऑफिसर लोगों ने गोद लिया, एनजीओ ने गोद लिया, मल्टीनेशनल हमारी कॉर्पोरेट सेक्टर ने गोद लिया, प्राइवेट इंडिविजुअल लोगों ने गोद लिया, जनप्रतिनिधियों ने गोद लिया, और एक मुहिम जनता ने उठा ली। तो ऐसा कोई भी प्रयोग आपके कोई भी लोगों के मन में आइडिया आए, सरकार के साथ शेयर करना चाहिए। और सामूहिकता से, पब्लिक पार्टनरशिप से हमें देश के डिसीज को एड्रेस करने के लिए कोई मुहिम चलानी हो तो चलानी चाहिए।
आरंभ प्रचंड है, लेकिन ये अभी काम अधूरा है। इस पर हम बहुत कुछ काम करने वाले हैं। ये आपसे वादा है कि आपको कॉन्क्रीट रिजल्ट्स आने वाले दिनों में जरूर दिखेंगे। मनसुख मांडविया जी, बहुत बहुत धन्यवाद, आभार आपका। प्लीज बिग राउंड ऑफ अप्लॉज।
थैंक यू
सर, एक आपसे रिक्वेस्ट है, ये कैंसर का एक छोटा सा आप पे पिन लगाना चाहता हूं, जो हम सब ने यहाँ यूनाइटेड अगेंस्ट कैंसर के लिए लगाया है।
Thank you, Anand. Thank you, Honorable Minister, for that wonderful conversation. Well, we're putting out a special AV for you, and this is about breast cancer. As per a Lancet report, nearly 6.9 million women who are detected with breast cancer and succumb to it, about 4.03 million women were treatable. And they could have saved their lives if they had proper facilities for preventive detection, screenings that they could have gotten at the right point in time. To bring in a positive change and to spread the message of regular cancer screening, News 18 Network has joined hands. Let's take a look at this film.
In India, 1 in 9 people are prone to cancer. And it's the top cause of death among non-communicable diseases.
मगर क्या हम इस जानकारी से डरकर बैठ जाएं? नहीं.
This statistic is an opportunity to fight fear, to fight cancer with awareness.
We can win over cancer with advanced treatments, medications, and technology, especially when it is detected early.
That's why it's important that you opt for regular cancer screening and timely health checkups for early detection.
रेगुलर हेल्थ चेकअप से कैंसर जल्दी पकड़ में आ सकता है ताकि उसे बढ़ने से पहले ही रोका जा सके।
All we need to do is to take charge of our health. So let's come together
and stand united
against cancer.
And as we embark on this campaign to promote early detection of cancer through regular screening, we are privileged to bring to the stage some brilliant and dedicated oncologists who have taken out time to be a part of this very special gathering today. Their groundbreaking research, unparalleled expertise and unwavering commitment have given hope to continue for various individuals and their families across the world. To moderate this very special session, I request our Managing Editor, Zakir Jacob, to please come up on the stage. And it's my pleasure and honor to also welcome our esteemed panel. We have Dr. Shyam Agarwal, who's a Senior Consultant of Medical Oncology at Sir Gangaram Hospital here in the National Capital. Ladies and gentlemen, can we have a huge round of applause for our very esteemed panelists? We also have Dr. Vineet Talwar, who is the Director of Department of Medical Oncology at the Rajiv Gandhi Cancer Institute in Delhi. Dr. Suversha Khanna, who is the Founder and President at the Dharamshala Cancer Foundation Research Center. And Dr. Sharmila Pimple, who is MD and Professor and Physician at the Department of Preventive Oncology, Center for Cancer Epidemiology at the Tata Memorial Center. Looking forward to this wonderful discussion.
Thank you very much, doctors, for joining us. It is indeed enlightening to have such a galaxy of oncologists to chat with about something that we seldom talk about here in India, and yet it is something that plagues each one of us, our families. All of us know someone or the other who has fought against cancer, and we also know someone who has won over cancer. So if we can find a template, if we can find as they say, a formula to detect early and to fight cancer, what may that formula look like? So that's what we'll try and attempt through the course of this conversation. I want to start with Dr. Talwar. There was this WHO report which suggested that 1 out of 10 Indians are likely to get cancer, and it's only going to get worse over the next decade or two. Could you give us an overview of what the situation is vis-a-vis cancer in India compared to some of the other countries around the world? And more importantly, is there evidence to suggest that early detection helps fight cancer faster and better?
Thanks for the question. As it has been already alluded, the incidence, that is the new cases which come in India, it's about 15 lakhs, 15 lakhs per year. But this figure would be a very bourgeois figure because the detection of cases, I think it would be much more than this. So having said that, if you have 15 lakh cases in a year, that itself poses a big problem, not only to the person who's suffering, to the family, and of course to the national exchequer. So cancer screening is a very, very important tool to, sift out the areas where we can cut out these costs, because India itself is a very, very price-sensitive market. And all of us know that when I, as a physician, I treat a cancer patient, I'm not treating the patient, I'm treating the whole family. It is a totally different ballgame as far as the other diseases are concerned. So, if you take an example, say cervical cancer, you have the infection with the human papilloma virus at, say, day 1. But for it to become a proper cancer, it takes about 10 to 12 years. So if you can cut that in between, cut it short anywhere, you're doing great justice. You are not only reducing the burden of disease, but then you are treating, you are able to treat more people in a lower cost, and of course you get higher success rates. So that way, I believe cancer screening is very, very important. But for that, you have to have the infrastructure.
Yeah.
You have to have the health education portals. You have to have the logistics. And of course, you have to have a dedicated team who can take care of all these things. So these are the 4 pillars on which one can work on. And of course, you have to have a very good data management system where you can capture the cases. And as it has been told earlier, India is not just like any small European country where you can, if anybody coughs, you can capture that. You have the east where you have the mountains, you have the west, you have the deserts, you have the north, you have the snow, and you have the south. So it's so diverse, so that, every area has to be individualized, and it has to be according to the nuances of that place. So definitely cancer detection is very, very important.
Dr. Agrawal, you've been in this business of spreading awareness that cancer is curable, and you've been saying this across the country for the last 50 years now. There is a statistic that 40% of cancers can be tackled simply by dealing with diet, nutrition, physical activity, etc. Could you elaborate on that a bit more? Because as Indians, we are a little infamous for our diet and for lack of physical activity.
So first of all, Zaka, taking a cue from the health minister, it's not a business. So we are actually looking at service of people whom we want to cure and we want to detect early. So as you said, more than 50% of the patients who come with cancer come from 3 categories: oral cancer, cervical cancer, and breast cancer. And actually, cancer is a lifestyle disease. How come lifestyle disease? Tobacco chewing is a lifestyle habit. So if you stop, chewing tobacco or smoking tobacco, you get rid of almost 30 to 40% of cancers which are associated with tobacco chewing and smoking. So it's an absolutely preventable disease. It's very easy to say, stop growing tobacco. I think the previous speakers did mention a little bit about that. But what about the farmers who are growing it, who are earning money from there? So it has got to be the vision of the Ministry of Health to see to it, and even the Agriculture Ministry, to provide alternative, means of income for people who are growing tobacco, number 1. Number 2, cervical cancer now, for example, over the last 20 years, actually was number 1 cancer. Now it has come down to number 2 in women. Breast cancer is number 1. Why? Because the hygiene has improved over the years of women who are living in towns and small, rural areas, as was pointed out. So actually cervical cancer has come down. Now coming to third common cancer, which is breast cancer. If you look at the West, almost, 80% of cancers are detected in first or second stage. Here it's vice versa. It's the opposite. Why? So many people sitting here. How many women after the age of 40 years are going for breast mammograms? Hardly anybody. So I think there's a dearth of, as Dr. Vineet said, people are not health conscious. So, that education is very important. Availability of mammography machines is important, not only in the big towns, but also in the small, district levels and even in the rural areas. So NGOs are doing a lot of good work by, going from town to town and going to rural areas with the mammography machines. I mean, people are talking of AI.
Correct.
So, recently there was an article where they said, actually AI can pick up more than 20% cases as compared to 2 doctors who are reading the mammograms. So there is a model available. So you can implement that. You can get the AI in detecting, more number of cancers in the same mammogram by using 1 AI machine and 1 doctor. So I think those kind of things have to come in. And oral cancers, again, can be detected very easily by doing an oral checkup. So, 40-50% of the cancers can either be prevented or detected early, provided the ministry has the will. And as the minister said, it's not the minister, all of us, whether we are the NGOs, whether we are at the district level. So we all have to come together to do this work.
So one of the points that Dr. Agrawal made, and I want to ask Dr. Khanna this, the grim reality is, and he quoted some of the global statistics which are inverse to what it is here in India. Globally, 30% of cancer patients are lost because of late detection, whereas in India, it is 70%. How can we change this?
It's not difficult to change at all. We just have to have the will. And I, for myself and for my organization, I can tell you that we are the only organization in Delhi who is doing free cancer screening for 4 cancers: the breast, the cervix, the prostate, and the oral cancer. You see, and we also have a bus which has a mammography machine, an X-ray machine, facilities for taking a pap smear, and an oral examination. So this bus goes from places to places. We have 2 cancer screening centers within the hospital, one in our main hospital, and then we have also set up a Dharamshila Rahat Medical Center, which is a palliative care center, but we are doing a cancer screening over there also. So cancer screening is not difficult at all. It's very easy. The problem is that we have to invite people and work so hard to get people to get cancer screening, in spite of the fact that it is free. It is totally free. And I'm very happy to tell you that practically 60 to 70 cancer cases we pick up per annum at an early stage when they're absolutely curable. Absolutely curable.
This is 60 to 70 out of how many patients?
We screen about, I would say, 100 cases per camp.
Okay.
And we do 3 camps a week. So 300
got it.
multiplied
It's about 1,200 camps a month. Okay, got it.
Yeah.
You know, one of the points that was made, and I think it was mentioned earlier as well, Dr. Agarwal referred to this as well, so I want to ask Dr. Pimple this. Everybody's talking about artificial intelligence and how it can change, it can transform different fields. In the field of oncology, do you see the possibility of artificial intelligence being used to detect early and thereby help prevent cancer, or at least to be able to cure it in a way that it's not fatal?
Well, so artificial intelligence has tremendous potential, no doubt about it, okay? But it has to be, developed and tested well, okay? Validation, verification of what the technology is, whether it is able to correctly identify, whether we are overdiagnosing, okay? So all these aspects have to be tested, validated in a proper research environment, and you'll have to undertake that kind of a research to prove that indeed the technology is working. And lot goes into the making of the technology also. Now we see plethora of, devices coming up with AI technology. Look, now there are WHO guidelines in terms of how these devices are to be looked into. It cannot be that anyone is approaching with an AI. AI has to be built in terms of if we take the example of mammography, AI in mammography also. Thousands and millions of images have to be collated, okay? That kind of data inputs have to go into that particular software or technology before it can be tested. And then you have to look at overdiagnosis and aspects, okay? It has to be, standardization techniques, okay? How it has to be applied. And then second, last but not the least, where the technology is going to be applied. For example, screening is different from diagnosis, okay? So the AI technology also has to be tested, whether we are going to use it into the field situation, population-based situation, or in a hospital context, okay? So, lot before, it can be actually made applicable into population-based settings or adopted into a generalized setting. So lot goes into the thing.
So, Dr. Talwar, you wanted to make a point on the AI adoption in oncology.
Yeah, what Madam has said is absolutely right. I just wanted to add that wherever you have mundane tasks where you want a high throughput analysis, like you have lakh patients and you want to see what is the hemoglobin of one patient. So you can put it through the AI and, if a guy does it, say in 100 hours, AI would be able to do in a fraction of a second.
Okay, got it.
So high throughput.
I want to get closing comments. Again, as Indians, one of the other things that we keep talking about is genetics. We know in the case of, for example, cardiovascular diseases, doctors put a premium on if you have a history of heart disease, you're likely to get heart disease. Does that necessarily apply for cancer?
Right. So I think this is a very important question. So only 5% of patients with cancer have hereditary gene, transmission from parents to, to offsprings. But cancer is a gene-based disease. Why does cancer happen? Genes get mutated or they get abnormal over a period of time. So we acquire these, because they said children don't get cancers, Why do adults and the elderly people get it? Because of the environment, because of smoking, because of drinking. It's a lifestyle disease. So the more you behave, misbehave with your system, the more genes get mutated. So it is a genetic disease. So therefore, all the patients, I think Harsh Mahajan is here. I mean, we are doing next generation sequencing today to diagnose cancers, which genes are abnormal. And we've gone a long way there. We've got drugs now which target those genes, and targeted therapies become the treatment for several cancers, not 1, 20, 30, 40 cancers. Cancer is not one disease. Cancer is 200 types of diseases. And there are like 20,000 types of genes which can become abnormal. So it is a genetic disease, but it is not hereditary. It is not given from the parent to the child. You acquire it during your life, and it takes several years to become 1 centimeter.
Sure.
So it takes 5 to 6 years to become 1 centimeter as a result of genes getting mutated over a period of time because of the nature, because of the environment, because of your lifestyle habits.
So the challenge is, and perhaps the solution also is, to test early and to fight surely, which is the tagline of our Sanjeevani campaign. I'll give the final word to Dr. Khanna. So when Dr. Agarwal said it's a lifestyle disease, what is the one thing that you see which is most prevalent amongst Indians, which is a bad lifestyle habit, which you reckon they should change?
I wouldn't say it is one, there are multiple of them.
Yeah, but the most.
The first most important is our tobacco and alcohol. That's
Tobacco
the
and
most,
alcohol use, okay.
And all the oral cancers is responsible. Not only oral cancer, other cancers also are related to that. Number 2 is our diet. You see, our eating style, what we are eating and what we should eat, and the things are getting from bad to worse. What was recommended was, and what has always been recommended, is what our grandparents did. Fresh vegetables, fresh fruits, whole grains, nuts, and all that. But now, pizzas and burgers, and you know what?
Fast food.
Fast food. And that has lot of fat, and that has lot of, you see, pesticide, I mean, not the pesticide, the, what do you call it? The
chemicals and
yeah.
So,
so that is there. And then, of course, you see, our environment. There are factors in environment that which are under our control, but there's plenty of it which we have no control on those environments. And then the infections, you see, again the infections are there, but they're treatable now, and we have vaccine. Hepatitis B is there, HPV vaccine is there. And HPV vaccine, that is why the incidence of cancer is going down so nicely.
Sure. Dr. Pimple, I'll give you the final word. Taking off from one of the points that Dr. Agarwal made, if it takes 5 to 6 years for a cancer to grow 1 centimeter, why then are we not detecting it early enough?
Well, so that's a good question, because like, I mean, you'll have to differentiate between what we are saying, that easily available technology, okay, that it is easy to screen, okay, but why aren't we, implementation is the thing, okay, which we have to focus upon now. It is not about the screening tool. Okay, we may be having the best of screening tool, and the screening tool could be adopted as per the resources. But like, I mean, the uptake, implementation strategies, like, I mean, going to the people and, I mean, community mobilization, motivation, okay, why aren't people taking up screening? Okay, that's one aspect, okay, of implementation research which you'll have to look into. Today the uptake is like, I mean, not very great actually. Like, I mean, if we say that we are screening, the actual screening is, active screening is not happening. Even among the non-communicable diseases fold, what we are doing for screening is, we are doing diabetes, we are doing hypertension, but the actual screening is not happening. Women are not coming up, okay? Now we'll have to look at overall cancer education awareness or component also. Is there any stigma attached to it? Why are not women coming up, okay? Like, I mean, these are examination of the private parts. So like, I mean, there are so many things into context, and then of course, the sustainable availability of the logistics, okay, health manpower training, sustained effort towards that, and continuation and sustenance of this particular program in implementation. And last but not the least thing, screening tool is not the only thing. Linking screen positives, okay, to appropriate diagnosis and treatment, and scaling up the infrastructure accordingly for cancer diagnosis and treatment is equally important. Probably we are losing out on that.
10 seconds after to wrap up.
So the biggest problem in the world is that the tools which are available, the imaging, whether it is a CT scan, MRI, PET scan, does not pick up disease which is less than 7 millimeters or 5 millimeter or 1 centimeter. So therefore, all of you sitting here, Harsh Mahajan is there working for the last 30 years. And the whole world actually is working on this. Can you pick up a 2 millimeter tumor? No. No way today.
Okay.
That's why screening means 1 centimeter. And 1 centimeter means 6 years already in the body of a patient.
All right. Okay, thank you very much. Can we have a loud round of applause for Dr. Agarwal, Dr. Talwar, Dr. Khanna and Dr. Pimpe. Thank you very much, doctors. Thank you very much.
Thank you, Zaka. A big thanks to our esteemed panelists for that wonderful conversation. We believe that the wonderful insights we have had today will serve as a guiding light leading to a new era of awareness, empowerment, and ultimately a future where early cancer detection becomes a universal reality. Well, once again, a reminder that at 9:15 p.m. we'll be joined by a very special panel of cancer fighters, actor and model Lisa Ray, cricketing legend Yuvraj Singh, and film director Anurag Basu. Now, moving on very quickly to our another panel, another special conversation. The ever-evolving demands, and this is about fighting cancer, what we've been talking about through the evening, it demands that dynamic solutions should come from research and pharma companies, which are at the forefront of this very critical arena. The innovations emerging from their laboratories, from their research facilities, have the potential to be the game changers and to revolutionize cancer care. Well, to lead this yet another special conversation, let me first invite Shireen Bhan, Managing Editor of CNBC TV 18, once again on the stage. Joining us on the panel is Mr. Amitabh Dubey, the Country President of Novartis India, also an associate partner in this campaign, to join us on the platform of Sanjeevani-United Against Cancer. Can we please have a round of applause? Dr. S.V.S. Deo, the Head of Surgical Oncology at the All India Institute of Medical Sciences. Dr. Harsh Mahajan, who's the MD and founder, also the Chairperson of Mahajan Imaging and Labs. Dr. Vinod Raina, Chairman of Oncosciences and Executive Director of Fortis Healthcare. Look forward to this special conversation.
Well, ladies and gentlemen, it is a pleasure to welcome these three gentlemen here on the program to take the conversation forward. I think a lot of the focus has been on being able to detect, being able to screen, being able to provide good quality, accessible health care, ensure that there is infrastructure that is geographically dispersed across the country. But I want to talk about what we are seeing now in terms of breakthrough, in terms of innovation as well. And Amitabh, let me start by talking to you about that, because Novartis has positioned itself now as an innovation-driven company, and specifically as far as cancer is concerned, it is something that the company is focused on, whether it's prostate cancer or breast cancer. You do have an innovation pipeline that's strong. You have drugs out in the market. Take me through what it takes to be able to put the research in place to create this innovative pipeline, and how confident do you feel about future breakthroughs?
Thank you, Shireen, for the question. But before I do that, I just wanted to say a big thank you to Network News 18, Rahul Joshi, Sham from Federal Bank, Tata Trust, for setting up this Sanjeevani. It's a fantastic initiative, and we are super proud to be associated with it.
No, thank you as well for being a part of
That's
this.
what
We
I said.
truly appreciate that.
We are super proud to be associated with the same. Cancer is the second leading cause of death, and that's established across. While there is a significant amount of advancement, Shireen, in the treatment paradigm for cancer, the cancer cells are even smarter. They trick us in the pathway which the drugs have and the human immune system. At Novartis, we are reimagining medicine to improve and extend patients' life. We are trying to bend the curve of life. And when I say that, what I mean to say is that our scientists will leave no stone unturned to ensure that we come up with newer therapies which basically extend life or are examples of potential cure. In the last 20 years, we have more than 25 treatments available for different type of cancers and cancers, and we have got 30 compounds in our pipeline which are targeting various pathways and various drugs. When you look at an example I want to give, 20 years back in chronic myeloid leukemia, which is a type of blood cancer, we came up with the first generation TKI, Gleevec, correct? Which transformed the way the treatment was given for CML. It moved CML from a cancer to more of a chronic disease. Couple of years back, we came up with the second generation TKI. Those patients who are relapsing, progressing, they are able to take this treatment and extend the life again. And now, about a year back, we launched a third generation TKI, STAMP inhibitor, which basically is for patients who are, again, progressing up to 2 generations of TKI and extending life. The importance is for these patients, if we are able to get deeper remissions, we can get treatment free. They can call off treatment, and it could be like a potential cure. Similarly, in breast cancer, 30 years for HER2 negative, HR positive breast cancer, apart from chemo and endocrine therapy, there was nothing. And then we came with CDK4/6 inhibitors, which are transforming and extending the lives of patients, providing overall survival to patients. And even in earlier breast cancer patients, we are able to ensure that 25% of people reduce the risk of recurrence of breast cancer. We are looking at newer therapies like cell therapy. We are coming into radioligand treatments, which are basically radioisotopes coupled with targeted therapies, which are like precision action. So it's a lot of investments, which is roughly about 20% of our revenue, which goes into ensuring that we continuously keep innovating to ensure that we continue to have either improved survival or potentially look for a cure for cancer.
You know, you talked about the fact that it is harder to deal with because it is the malady of the cells that we are talking about here. But do you believe that in the future, when we talk about breakthrough innovation, that it is going to be found in the cell itself as opposed to a pill?
A lot is happening, and doctors will talk about it, but Dr. Rana is there. There is happening, which is immunotherapy, which is basically inducing your own immune system to act against the cancerous cells. And a lot of therapy is happening around that. There is messenger RNA treatments, which are vaccines available, which is working on. So there is an ample area that is working on. Cell therapy, which is basically utilizing your own cells and genetically modifying them to target against the cancer cells, is something that we are all talking about. So these are areas where there's constant innovation to keep addressing, because cancer is not just one disease, as was told by Dr. Zulia. It's a complex disease with multiple pathways, with multiple genes. Just to give you an example, Shireen, quickly, there are more than 20,000 genes, out of which 60% are non-transcripting. We have more than 20,000 known proteins, out of which only 3% are being targeted by drugs currently. And we have got more than 10,000 diseases, but we have only treatments for 500. So there is a lot of work that even on the genetic level that we need to do for various types of diseases.
No, there is plenty of distance to be covered, but a lot of distance has already been covered, as you point out as well. So Dr. Raina, let's address that. Let's talk about the journey that we've made, but more importantly, what you believe the future looks like. We've just heard from Amitabh about some of the examples that he talked about in terms of the kinds of innovations that we've seen. In your career, which spans several decades now in dealing with cancer treatment and cancer patients, what do you believe have been the milestone changes that you've seen, and what do you feel now most confident and optimistic about as we look ahead?
Thanks very much. I think you already mentioned Glyvic and some other products like rituximab and Herceptin, which are now old stories. You know, they were discovered in late 90s, early 2000s, and they are still they are still in use, and they have changed or transformed the life of many patients. The recent discoveries in the last 10 years have been immunotherapy. These were also targeted therapies. You know, the Glyvic, if you say today, they were also targeted therapies. But the talk of targeted therapies and immunotherapies has become very, very, active in the last 7 or 8 years. I'll give you an example of lung cancer.
If you can just hold up the mic, sir.
I'll give you an example of lung cancer. I would say before 10 years, the survival of stage 4 lung cancer used to be less than a year. You know, if he comes in stage 4, he would not generally live more than a year. In certain subtypes of lung cancer, which accounts for nearly 30% of all lung cancers, the survival has now changed to 5 to 6 years and maybe more. We're still counting. Many of these patients are still alive. So there's been a total transformation in outcomes of lung cancer thanks to immunotherapy as well as targeted therapy. Similar things have been happening in other fields like lymphomas, leukemias, breast cancer as well. New targeted therapies in certain subtypes of breast cancer have totally transformed the outcome. The problem is how to deliver these new molecules or new methods of treatment to the vast masses of India.
So how
That
do you
is the
make them
challenge.
affordable?
I think that has also changed quite a bit. You know, the innovative drugs which have now been in the patent has expired.
Yeah.
The generic drugs, for example, Herceptin, when it was launched, I think each injection was about 1.5 lakhs. Today, Herceptin is available in generic form for 20,000 rupees, 25,000 rupees. Similarly, other drugs like rituximab, costs have come down drastically in drugs that were discovered 20 years ago. Same thing will happen to new drugs that have been discovered in the last 5 or 6 years, because the patent, we are signatory to the patent. The cost will continue to be high till the patent expires. Once the patent expires, the cost will come down drastically. That is one way of going out. Other ways, as the minister said previously, the capping of prices and exorbitant prices that some companies charge. I think that's a great service the government of India is doing to the masses to cap the prices of expensive cancer drugs. So these are some of the measures. Plus finally take these drugs to the masses, which is still not the case. I still don't think that we have reached or touched the hinterland of India. It's okay to look after the cities and second-tier cities. But if you go 50 miles out of Delhi, you will find that it doesn't exist. The cancer care doesn't exist. So that is the challenge.
Yes, the story outside of our metros is very, very different, especially when we talk about cancer care, and I'll address that issue in just a second. But Dr. Mahajan, let's talk about some of the changes that we are seeing, especially driven by technology. We're now talking about much more targeted treatment, personalized treatment. That is the aspiration and the hope as we move forward. The same question to you. What have been some of the most breakthrough innovations that you've seen, and what is the expectation now in terms of the work that's going on, the research that you see at this point in time? What would you look forward to?
Thank you very much, Shireen. Just as on the therapeutic side, I think on the diagnostic side, we've moved quicker over the years, both for imaging, on the pathology side, and most recently and more importantly, for cancer on the genomic side. So today, as we know, we talk of prevention, and we've heard in the previous panel, preventive medicine. We today talk also of predictive medicine and precision medicine. And all of these are mandated by diagnostics. And let me take them one by one. We've all heard since we were kids in school, prevention is better than cure. But as has been said, prevention is much cheaper than cure. So if we are able to prevent, we are able to diagnose very early, stage 1, stage 2, not only do you get a cure, it also costs you much, much lesser. We are a country of 1.4 billion individuals, and we can ill afford. We cannot be as, cannot spend the money like they do in the West. 18% of US GDP spent on healthcare. That's over $4 trillion just on healthcare, and yet they're not where it's an ideal situation. So prevention. Now how do we prevent? Here we come to the predictive part of medicine, where currently things are very expensive. This is, there are, say we talk of breast cancer, ladies who are at average risk for breast cancer and those at higher risk for breast cancer. Now, if we just pick up those at higher risk, and there are multiple factors which, a family member having breast cancer, obesity, alcohol intake, living in urban environment. Dr. Badwe just talked about, a lady living in a city is at twice the risk of developing breast cancer than someone living in a rural area. So if we could target these individuals who are at higher risk and screen them much better, starting, they say in the West, 30 years of age, and I think that would be the right time in this country, where actually cancer, we get about 10 years earlier than in the other cases. And here, genome sequencing and maybe certain other innovative methods where from just a few drops of blood, you may be able to pick up cancer cells. You talked about cells, and that's where a lot of effort is happening. And if this could be done at a low cost and could be done at a population level, you could pick up out of those 1.4 billion, maybe 100 million who are at much higher risk for cancer and target resources which are limited to these people, screen them much better, pick up disease early so that we are able to cure them. Then we come to precision medicine.
Yeah.
And precision medicine is where, based on next-gen sequencing and subsequently imaging, you are actually looking at the cancer tissue, those cells, conducting next-gen sequencing on them to target specific treatment, much lower side effects, much better effect on cure, and maybe some large tumors, maybe a 2-centimeter tumor, based on NGS you decide no chemotherapy is not necessary, whereas a 5-millimeter tumor you say no, based on the biological nature of the tumor you need to do it. And in all of these, it is newer innovations that are helping. Now a word about what's happening in our country.
Yeah.
And here, if I talk about breast cancer, the Government of India initiative out of CMET, that is in Thrissur in Kerala, we've actually, and I'm part of that team, we've been able to develop a bra which will have thermal sensors within,
Okay.
which a lady wears for 10 minutes. It's attached to a computer which has AI inbuilt.
Okay.
We know that cancer cells actually emit more heat, and CMET actually makes very, very sensitive thermal detectors. And I think we've reached a stage where we feel pretty confident that this technology is going to work. And these are
When do you think you'll be able to commercially roll this out?
That's up to the government. We've already floated, expression of interest. There are companies interested in doing it. So just imagine this, a laptop with this bra which has thermal detectors going from village to village. I mean, it's very tough having these large vans with
No, and it's
mammograms.
uncomfortable. I mean, any woman who's gone for a breast cancer screening, it is an awkward and hugely uncomfortable situation to put yourself
So this
through.
is happening. So we will have to find solutions within our country. And then artificial intelligence, and I can tell you, here again, a lot of work being done within the country. Small 2-3 people groups, larger conglomerates, people like us who just dabble in research, and of course the IITs and the larger healthcare institutions. What is lacking actually is collaboration. That's where I think we lack. When we talk of PPP, we talk of public-private partnership. That may be happening. But I also look at PPP as private-private partnership, which I think we need to give a fillip to, and the onus rests on us to do that.
No, I agree with you, and I would like to add another P to that, and that is the patient, because very often when we talk about these partnerships, we forget about the
You are
patient,
so
and
very
we really
right.
do need to keep the patient at the center
You're
of
so
the
very
conversation.
right, Shireen. All of us in this hall, what are we here for? What do we do medicine for? What do they make drugs for? What does he treat? Ultimately, it is all for the patient, and the patient has to be kept at the center. And it has to be patient-centric diagnosis, patient-centric treatment. Unfortunately, with technology come costs. And that's where the problem is. I mean, we want the best for our people, for our citizens.
No, but there is a reality that we need to deal with. When we talk about R&D budgets, I mean, Novartis' R&D budget is significantly higher than all of the Indian pharma companies
So
put together.
I'll say something which may sound unpalatable to people. Good treatment costs money. Good diagnosis costs money. And if we are not willing to accept that, then I think we are doing a disservice to that citizen and to that patient.
No, I agree with you. The question, though, is how do you actually make it accessible, and what are the ways of being able to do that? But Dr. Raina, if I could come to you, sir, and understand from you what you believe the interventions are at this point in time, what you believe we need to do both at a policy level as well at the level of the private partnership as well as the public-private partnership that we often speak of to ensure that we do try and make the best of what we have, but also ensure that this innovation ecosystem that everyone's been talking about benefits the Indian patient?
Well, thanks. I started practicing oncology year about 1980, and I've seen a huge transformation, huge change in access to cancer care. You know, when I became an oncologist, there were not more than 100 oncologists in whole of India. Now there are thousands. So I'm sure there'll be a transformation in India in the next 20 years, 30 years, which you cannot recognize today, you cannot anticipate today. I think generally things are on the right track. The government is investing, the industry is also investing. They are creating more medical colleges, more specialties, more training centers. I think it will dissipate, or it will percolate into the hinterland. It will go into the villages,
Yeah.
and I think you'll see a total transformation in this country in the next 20 years, which we could not have anticipated, and I really believe in that.
And what do you believe will be the key drivers that will propel this transformation?
I think investment, education and training. Investment, education and training.
Investment, education and training, and you believe that we could over the next 2 decades see a transformative
Total
change
transformation.
as far as cancer care is
I have
concerned.
seen that in my career.
Absolutely, and we're looking forward to seeing that transformation. Amitabh, you know, let's address investment, education and awareness, of course, which is what we're hoping to do here as well, and training. You know, what would you like to add to that? What are the pillars specifically that you're going to be focused on?
So just to add to what Dr. Mahajan said, Shane, at Novartis we are trying to pilot some projects which is using AI technology for early detection in breast cancer. We are trying to tie up with private partners, which is us, startups which have got the AI technology, as well as government partnerships, and adopt a pilot project. And if that's scalable, then move it to a larger population.
And this is India specific.
Exactly, in India. And we are also trying to look at how these models, along with the state governments, can be replicated at a much larger country scale. But what more we can do is 2 things. One, we have to remember that only 5% of the population has an access to screening.
Yeah.
Or they talk about screening, or even think about screening. We've had this multiple discussions across. Screening is the only way you can prevent cancer, address it early, and have a better outcome of treatment. We need to increase the screening efforts across the country, have a bigger voice across screening, and that could be done through awareness. From Novartis perspective, I can tell you, Dr. Rana talked about access. We are addressing access at 3 stages. One, we are trying to ensure that all our global trials have patients from India, and they get access to treatments early. We have a global MAP program that till the time the drug is not registered and people can't get access, globally they can apply on managed access program and the drug can be imported. And once we register the drug in India, we have either a tiered pricing approach or we have support programs to ensure that we are able to provide to a bigger population. So that's additional that we do to provide access to the patients.
Well, doctors, in exactly a minute each, because we're totally out of time, but I think it's important, you know, since we're talking about the importance of screening, the 5 red flags that each one of us should be mindful of when we talk about the possibility of cancer. What should we look out for? What should we be watchful of? Dr. Mahajan, I'll start by asking you.
See, I think a cough that is unremitting without fever. If you have blood in the stool or in urine, any ulcer in the mouth which is not healing, 3 weeks, 4 weeks, and again a headache which may not go away. These really, you know, you can't really put your finger on that, and that's why at times screening is necessary to pick up the disease before it actually manifests into symptoms. And that's why it's called the silent killer. That it has spread, it's stage 4 by the time you realize, and that's where screening plays a role.
Dr. Raina?
Well, I've been emphasizing in my talks that cancer is directly related to aging. The incidence of cancer rises once you cross 50, 55, and it rises very, very sharply. You won't believe it, at the age of 80 years, every 7th or 6th person will suffer from cancer. So there's nothing you can do about aging, you know. But certainly you can, introduce screening programs which are targeted to certain population and certain aging. There's a lot of talk about screening, but there's no proof that screening works at the age of 35, 40 for breast cancer or some other cancers. Screening also has to be meticulously targeted to a population. The aim of the screening is to reduce death, mortality. And that you must do. What has happened with screening programs is that because of vast screening, especially in US and Europe, patients have been diagnosed with early cancer. Now, when you diagnose a patient with stage 1 breast cancer or early stage cervical cancer, it's unlikely that that patient will die in the next 10 to 20 years. So to wait for the benefit of screening programs, you may have to wait for decades to see the success, reduction in the mortality, because it picks up very early cancer. So I think people should be aware that as the aging goes, aging is directly related to incidence of cancer. Once you're past 50, you must go for careful screening at least once a year, get yourself checked up. And the beauty of early diagnosis is the survival is so far superior as compared to patients with stage 4 disease. That
Absolutely. And gentlemen, that is wonderful advice that you've shared with us here. Thank you very much, doctors, for joining us. And Amitabh, it's an absolute pleasure. Thank you very much. We do hope that we see the transformation that you spoke of, Dr. Raina and Dr. Mahajan. We look forward to the commercialization of some of the innovations that you spoke of, and we look forward to seeing much more from Novartis here in India. Ladies and gentlemen, a big round of applause for our panel this evening.
Thank you, Shireen. Thank you, gentlemen, for that very enlightening conversation. Moving on, it's an honor to introduce a true pioneer in the field of cancer innovation. Please join me in extending a very warm welcome to Dr. Gaurav Narula, a visionary researcher whose groundbreaking work is poised to revolutionize the way we combat blood cancer. His role in spearheading the clinical trials of CAR technology at the Tata Memorial Center is nothing short of extraordinary. The results of the first phase of the trials are very encouraging, offering hope to countless individuals battling blood cancer. Dr. Narula's tireless efforts remind us of the transformative power of innovation. Can we please have Dr. Narula on the stage right now? Ladies and gentlemen, a huge round of applause for him.
Thank you very much for that very, very kind introduction. I do not think that I'm really worthy of such astounding praise. It's indeed a pleasure for me to talk to you about our journey, and I'm especially very, very, inspired by the fact that the Honorable Health Minister talked about innovation, and it was just mentioned in the previous panel also what role it has in oncology and where we can go from here. So since my talk is a bit technical, it was agreed that I can have slides so that I can explain these concepts to you and about how we went about it. So I'm from the Tata Memorial Hospital, which is this set of beautiful buildings which you see. This photograph was taken after a cyclone had just passed in 2020 and given to me by a colleague. My talk is mostly about the power of lymphocytes and immunotherapy. We just heard how the immune system can be used to target cancer. And this is a photograph of two cancer cells sort of riding piggyback on a lung cancer, two lymphocytes in red, which are sort of riding piggyback on a large cancer cell. But they're not just taking a ride over there. If you see, they're fully capable of okay, the video is probably not working. They're fully capable of rapidly engulfing these cancer cells. Yeah, that's it. So you can see over there the cell in green is a lymphocyte, and the cell in blue, it's rapidly, it can tackle it and it can destroy it. So this is something which, for me, the personal journey started. I'm an Indian Navy veteran, and about after 25 years of service, I left the Navy to join Tata Memorial Hospital to pursue my passion. And one of my friends, when I had just been a few months into Tata Memorial Hospital in 2012, he sent this email, and when I opened the link, it read to the story about this girl whose last hope, she had B-cell acute lymphoblastic leukemia, and which had relapsed and was refractory to all kinds of treatment. And then she had received this novel therapy called CAR T-cell therapy. She had a really, really severe problem with that. She went into what we call a cytokine syndrome storm. Yeah. Okay. She went into a cytokine release syndrome kind of storm. They found a solution for it. They gave her the medicine for it. All her fevers, etc., came down. And then later on, when they did a bone marrow, the leukemia had completely gone. This was a remarkable story. And when I discussed this with my friend, I can never forget his words. He said, "Gaurav, this is science fiction." And in 2012, it really did sound like that. The reason for this is that, the lymphocytes have the power to kill cancer cells. Then why do we get cancer at all? We should not get cancer. It should be able to finish it off the moment we, even the cancerous change starts in the body. The reason for that is that one, the cancer cells are smart, as you just heard. They learn to evade the immune system. And two, the immune system was primarily designed to treat infections, not really cancer. But the moment we step into the world, we are confronted with all these thousands of bugs, and that's what the immune system is meant for. That's why we survive into adulthood. But once we become adults and age, then the body is dealing with cancer, and the immune system doesn't really know what to do about it. So what we learn from this is that the immune system can tackle cancer, but it needs help. And there are a couple of ways to do that. One way to do that is to take out these lymphocytes from the tumor, expand them in the lab, and give them back in large numbers. So basically, if the small army could not do it, let's send a large army there, and maybe that can do the job. Another way of doing it is to take out these cells from the body and modify them genetically and give them a target by which they can recognize the cancer, expand them into large numbers, and then infuse them back into the body. And that is what we call chimeric antigen receptor T-cell therapy. For this, we use the properties of a virus. Basically, viruses can infect cells, we know that. And here is a graphic showing the HIV virus, which can latch on to a lymphocyte and inject its RNA inside, which integrates into the DNA. And from there, it starts producing copies of itself. And it produces thousands of copies itself, destroying the host cell in the bargain. So what we want is, we want this part, but we don't want this part. So what we do is that we keep the genes which can latch onto the cell and insert the genome, but we change the gene it is inserting into the cell, and we replace it with a gene that we want. This gene codes for an antibody, which then gets represented on the surface of the cell, and now this one can recognize the cancer, and it is anchored to the T cell, so it remains on the T cell. So in this case, the target of the antibody is CD19, which is expressed on all B cells, and these cells, once they are given back, they can engage, and not only do they destroy, but they proliferate in response to the cancer, and they can rise in numbers to meet the challenge and clear the cancer. So in effect, it becomes a living drug. And the concept got proved as Emily Whitehead, whose story you just heard. As she grew further and further cancer-free, the clinical trial started. And this landmark trial in the University of Pennsylvania with 107 patients showed complete remission rates of 81%, and which stabilized around 1 year down the line to around 50%. Now this is huge. In the history of cancer treatment, this has not happened. That completely relapsed refractory disease, which is not responding to anything, half of them going on to live 1 year and probably not getting the disease back at all, is an unprecedented step. Following this, obviously, the rest of the world also caught on. The number of trials in CAR T-cell therapy started increasing exponentially. This graphic shows you that by the end of 2020, more than 1,000 trials were going on in just leukemia alone, all over the world. But where were these trials occurring? As you can see, as what the Honorable Minister just told us, all of it was going on in the global north, and by 2018 itself, China had overtaken USA. Even Europe, etc., were just having a handful of trials. There was nothing going on in the global south at all. And of course, once so many trials occurred, then the approvals started coming. In 2017, the first one by Novartis itself, that is the University of Pennsylvania CAR, was US FDA approved. And after that, nearly 7, 8 more have been approved. And the Honorable Minister just told us about another form of gene therapy which cost nearly 16 crores. When these hit the market, this is the price tag that they came with, nearly $500,000. There is no way that this would be ever affordable in India. It's challenging enough in the West to afford this. So in 2012 to 2015, we had different challenges. This shows you that B-cell acute lymphoblastic leukemia, which Emily Whitehead had, is basically a highly curable disease, as Dr. Badwe said earlier regarding pediatric cancers. In each passing decade, we had improvement in outcomes from virtually nil. By the late 2000s, early 2006 and 2009, nearly 95% of children with this disease are surviving. And how are they surviving? Most of these advances came with chemotherapy, and if they relapse, then it is due to transplant. Now we have chemotherapy and we have transplant, but we were finding that our outcomes are somewhere in the 70 to 80% range, and we are 3 to 4 decades behind the West. And the reason for this is that we are also seeing that, with chemotherapy, we are able to treat 70 to 80% of these children. But when these kids relapse, there is hardly any outcome. Now, this is not because we don't have transplant. As you know, 4 decades ago in 1983, Tata Memorial Center did the first transplant in India. 4 decades later, there are so many more centers doing transplants. A lot of transplants are going on in the country, but the need is too huge. Most of the children who need a transplant just can't get it. So basically, the outcomes overall, when you see, are very poor. So then we started thinking that if we start, even if we triple our transplant capacity, quadruple it also, we're not going to make a dent in this. We needed something transformative to meet this challenge. And that's when I was very, very fortunate enough to meet the brilliant scientist, Dr. Rahul Purwar, right in our own backyard in IIT Bombay, who was working on CAR T-cell therapy. The two of us got together, and he was already working on it, so I told him, if you can design a novel CAR T-cell vector, which will be able to tackle CD19 positive disease, then I will be, we can work together and we can take it to clinical trial. And he said, give me 2 years. 6 months later, he said, we are ready. And after that, what we did was that, we said that, okay, the designs are there. Then, we thought that we'll do all the work together, the developmental work together. We were very fortunate that the National Cancer Institute, with lead investigators like Dr. Terry Fry, Dr. Nirali Shah, and Stephen Heifel, they agreed to mentor us and, become knowledge partners. So basically, there was no funding that we received from them. There was no materials that we received from them. So it was only guidance. So from beginning to end, this was a made in India product. These are the milestones that we went through. We started in May 2015 as a collaboration. You talked about collaboration and PP collaboration. This is a public-public collaboration. 2 public institutes got together to join hands to make this happen. But initially, apart from our institutes, nobody really supported us. Apart from our director, Dr. Badwe, and the director of IIT Bombay, nobody really believed we could do it. All the grant applications that we put up were desk rejected. They came, I think, I used to hit the submit button and I used to get a rejection. But finally, it was thanks to a grant by Tata Trust in 2017, which gave us nearly 3.6 crores, which really sort of got us going. After that, there were all these milestones, and we were able to go on to start the phase 1 trial and even phase 2 trials, and I will just cover that in a bit. So the first thing that happened was designing a new CAR. So this was the tough part, which Dr. Rahul Purwar and his brilliant team did. Not just one, they designed 3. And then, seeing the early data, we picked up the one which was most likely to work. That's being represented by the blue line over here. And we said we'll take it forward. This is what it really looks like, rather than those neat diagrams. This is what it looks like in real life. And then we did all the preclinical tests which were necessary to show that it works. Basically, this chart over here shows that we could convert most of the lymphocytes into CAR T cells. And these graphs show that when we made them tackle CD19 positive cells, they were getting destroyed. And this graph shows that if it did not express CD19, they did not get touched. So this was a highly selective therapy which could target exactly what we wanted and not touch anything else that we didn't want. And the most important thing was, when the patents were filed, it met all several novelty and inventive steps and industrial applicability Most importantly, it got a worldwide freedom to operate, so we were free to develop this without infringing on anybody's patents or rights. The next step was that, okay, we did all the preclinical studies and there were many more, but then how do you manufacture it? If you want to use a product for human beings, our law, in fact any country's law, requires that you manufacture it to human use levels, which is normally done by big pharmaceutical companies and they with big budgets. You require a good manufacturing practice facility, which is regulated by the law of the land, by the DCGI and the CDSCO, and then you have to prepare it over there. And this often entails a lot of changes in your protocols from the lab. Now, we didn't know who was going to manufacture it. We tried to wait a long time for some industry party to pick it up, but I'm really sorry to say Indian industry did not pick it up. So we said we'll go it alone. And that's what happened over here. This is just to explain to you how manufacturing occurs. Basically, we have the vector, which was designed by Dr. Rahul Purwar and his team, and we have the blood from the patients. What we do is that these are what we call the inputs. Then we take them through all these steps, which you need not know, just that several steps are allowed. Then that is called the production process. And then we do all these quality control tests on the final product, and then we have what we call the final product, that is the CAR T cells, which are now ready to be infused. Basically, in pharmacological terms, you could say that this is the drug substance, the vector that we have designed, this is the drug process, and the final output is the drug product. Now, all of this needs to be done in legally compliant industrial setting. So how would we do it? What happened was that Dr. Rahul Purwar converted his own office into a GMP facility. This was a small-scale GMP facility which we were able to make small batches of CAR T cells, and we would be able to take it to trial. We constructed a similar facility in Tata Memorial Center. This facility got the CDSCO approval for the trial. The next big challenge was regulatory compliance. When we started in 2015, there was no regulatory network. We didn't know the law that we would need to meet to be able to get this into a human trial. So we started following the US FDA norms, and very grateful that in 2019, finally the document was brought out by the government of India, and the committee was formed and the regulations were formed, which would be allowing us to use cell therapy in India. But this is just an indication of the number of committees which had to screen this. And for the best part was, and also the worst part, was that for many of these committees, this was the first such work reaching their desk. So it was a learning experience for us and for them, and there was a lot of mutual learning by which we were able to make the path forward. And this was just for the preclinical work. For the clinical trial, we had to again pass through all these hoops. And anybody tells you the DCGI in India is not tough, I can tell you we were grilled for hours and hours and hours on this. In the end, I was wondering, don't these people take a break? I mean, when are they going to even have lunch or something, or a tea break? They just grilled us and grilled us and grilled us. In the end, fortunately, there were just 3 minor observations, which we managed to put together rapidly, go back to them with the results 3 months later, and they approved it. So with this, we were able to publish our work, and on the 4th of June in 2021, the first patient for CAR T was infused in Tata Memorial Center, and it was hailed as a historic day for our country. And 2 weeks later, my colleague, Dr. Hasmukh Jain, was able to infuse the first patient with lymphoma also at our center. And this is the teams which did it, along with Dr. Rahul and the BMT team in ACTRAC, and the leukemia lymphoma team from Tata Memorial Hospital on the adult side. And with this, we were finally able to put India on the CAR T map with 2 clinical trials starting in the Global South. Thank you. But things have moved on. So in 2021, we had 2 phase 1 clinical trials starting, which was a collaboration between Tata Memorial Center and IIT Bombay. But within a short while, in 2022, we had Immunil, which opened a trial in Bangalore and later on in Chennai. And Dr. Rahul Purwar went on and founded ImmunoAct, which is a startup. And with this, he was able to open 2 phase 2 trials in a multi-center trial, which included Pune and Hyderabad. And then in 2023, Immunil opened also in PGI Chandigarh, and now CMC Vellore has also opened its own trial down in the south. So in a short span of 2 years, from nothing, we already have 6 running clinical trials by 3 different groups, and a lot more is yet to come. All India Institute,
Dr. Reddy's, Intas, all these people are now working on CAR-T and cellular therapies, and 2024-25 you're going to see many, many more. We already believe that more than 100 patients have been treated on CAR-T trials in India already. So finally, what my friend calls science fiction has become a reality. Do we have our own Emily Whitehead? Yes, we do. This was a story which was covered in Times of India of an 8-year-old girl who took treatment with us, and her father clearly said that CAR-T saved her life because she was not responding to anything when she entered into the trial. As you can see, probably that this news is from October 22, so we are a year further down the line. This child is now 15 to 16 months post-CAR-T and in complete remission. Also, the same article was covered in a different way with a slightly different headline saying that, is this the miracle cancer therapy we have been waiting for? And covered the same story but slightly differently. This I can answer very, very easily. No, it's not a miracle therapy. It's a big advancement. It's a lot of promise. But to call it a miracle therapy is also overhyped. But at least we have made a beginning. But in the meantime, the world has moved on. CAR-T trials, like I told you, by 2020 had expanded so much that there are more than now 2,000 trials occurring in 2023. I believe more than 4,000 trials are going on. Many of them are against CD19. But also now people are working on solid tumors and others. Now these remain challenging, and there is a lot of promise, but we still have to wait for the results. Early results are promising, but when we doctors say promising, we don't necessarily mean what the public understands, that it's actually working. It takes time to prove these things. But despite all our efforts, what we have done with 6 trials, we probably are still now 8 to 9 years or 7, 8 years behind where the world has reached. So we need to get there very fast. And in the meantime, the technology is expanded. Tell an engineer, this is what I want, and they will come out with 10 different ways to do it. And this is what's happening. People are talking about universal off-the-shelf cars. No need to wait. Make it and keep it ready. Patient comes, give it. They're talking about switch-on, switch-off cars. Give it, switch it on. If it's getting too toxic, switch it off, and so on. They're talking about alternatives to antibodies. Can we use it? Can we use something else? Even the manufacturing itself is a huge area of research. And can it be used in combination with other drugs which are already available, like checkpoint inhibitors, etc.? So these are all the innovations coming, but each one is going to require its own trials. Science works slowly, but when it works certainly. So it takes time. So what is the road ahead? Well, a lot of clinical challenges first. As a clinician, the first thing I think is clinical challenges. We are giving these patients this therapy, and we don't know what all it's going to do. So we have to follow up these patients now and find out the toxicity and the long-term management. For patients who respond, what next? Should we just leave them alone, or should they get some more therapy? We have to work out these solutions. How to harness all the expanding technology? We cannot invest in everything. Everything fancy which is going around in the West will not be applicable to us, and we don't have that liberty. So we should choose wisely which ones of these technologies we should take forward. What are the best strategies to use these products? We can't use it with transplant all the time, so can we have cheaper alternatives? So those are the strategies that we need to look at. Treatment of cancer occurs in combination. We use radiotherapy, chemotherapy. So why are we looking at CAR-T cell therapy as a single, one-off solution? Maybe it will work best in combination. So those are the things which we need to look at now. And the last 2 things which are very important: capacity building and education and training. So to wind up, I will just cover these last 2 things. I believe that capacity building is a force multiplier. This was just one car that we did, but because of the ecosystem which has been created, there's a capacity now to do a lot more. Already, because of this, Dr. Rahul and I, and Dr. Rahul and with other members of our group from Tata Memorial Center are already working on 2 different cars, and hopefully these shall reach trial soon. Also, because we have the capacity, we are working on in-house innovation. And these are the cell therapies which are being worked on in Tata Memorial Center by my colleagues because we have the facilities now. Also, we are working with international and national collaborations on different kinds of cars. And this is not just us now. Now there's a lot of people who are doing it. And we are going to see very, very exciting times in the future with new drugs and new innovations coming in. But it's all going to need funding. And that's where the crunch lies. And as the last part,
to educate, our job is to teach, we are professors, so we believe that now that we have the capacity to spread, if the industry is to grow, industry needs workers and trained workers, and they look forward to the public sector for that. Academies and universities need to train them, so that's what we are doing. We started holding this series of cell therapy workshops, and we thought 40 people will come for the first one, but more than 200 people came, and now we are having the second one that is at this weekend, and already 250 people are registered for that. There's a big hunger in our country to learn about this and get hands-on experience on this technology, and we are planning an even bigger one coming up in February. So with this, I would like to conclude, but there are a lot of people to thank. First of all, are our own institutes. If it was the unwavering faith of our director, Dr. Barve, in this project that held us through thick and thin. And similarly, director of IIT Bombay on the other side for Dr. Rahul, who supported them even when we didn't have grants. But it was only when Tata Trust finally gave us a huge grant that we were able to get going. And then the government of India gave us a nearly 19 crore grant through the National Biopharma Mission, and that is what has propelled our work forward. I'm supported by large teams, many of them behind the scenes, but it takes really more than a village. But apart from the teams, etc., the person I need to thank most is, of course, this brilliant genius of a scientist, Dr. Rahul Purwar, on whose work we were able to, take all this forward. And, of course, our collaborators and guides from the National Cancer Institute in Bethesda. I would be failing in my duty if I did not acknowledge the roles of patients and their families. I think of all cancer patients are very brave, but the bravest are those who take part in clinical trials. And with that, I thank you for your attention, and News 18 and the hosts here for inviting me to talk about this.
Thank you, Dr. Narula, for those insights. And now it's time to hear from Luke Cutino. He's a dedicated healthcare professional who's at the forefront of a revolutionary approach to cancer care. With a passion for holistic well-being, Luke has established a comprehensive and personalized program known as the Basic Cancer Care. And to tell you more about it, can we please have Luke on the stage?
Hi, good evening, everyone. We heard a lot of heavy stuff on oncology today. I'm going to talk about lifestyle. The most common question that I get every day from my patients is, Luke, is there a food that can prevent me from taking chemotherapy? Is there a food that can avoid me taking a pharmaceutical drug? We think the pharmas are here to kill us, oncologists are here to keep us sick. We answer these questions every day. And every day our answers are the same. There is no food that is a replacement for chemotherapy. There is no food that is a replacement for your pharmaceutical drug. Food and nutrition is supportive of your treatment. When we talk about lifestyle today, and we talk about holistic medicine, a lot of people think we have a choice. Can I take alternative medicine versus chemotherapy? But today, with all the speakers, you understand that cancer is a multifactorial disease. It's not which system is best for the disease. It is what is right for your condition. So your chemotherapy plays a role. Your radiation plays a role. Your surgery plays a role. Your hormonal treatment plays a role as well. But also, the food that you eat, the movement that you have in your life, the exercise, the impact of your sleep, and your emotional wellness all work together with your pharmaceutical drugs and your treatment for a better outcome. We work very closely with the foundation of angiogenesis. Today, even nutritional science has only scratched the surface when it comes to cancer. People say, what are the best foods for cancer? There are no best foods for cancer. Food works in synergy with one another. So, for example, when you look at nutritional science for cancer, you look at angiogenesis. Which are the foods that are anti-angiogenic? Which are the foods that produce angiogenesis? Which are the foods that can impact your DNA positively and negatively? Which are the foods capable for stem cell regeneration? Which are the foods necessary for your immune system? But can foods replace immunotherapy? No. They're completely different. But your foods can be supportive of great immunotherapy. And then you have the microbiome, which is the gut. One of the most important systems when you have any disease, be it a cancer, be it a pimple on your face. When we talk about lifestyle medicine, it's not a choice. It's what the human body needs. Like a particular tumor will need a particular kind of chemo. A particular tumor will need surgery. Likewise, a particular body requires the fundamentals of human anatomy, which is lifestyle. As our health minister spoke, the word holistic. It's not about the fight about which system is better. I think the beauty of holistic medicine is it respects individuality, bio-individuality. Everyone is different. Oncologists know this. Every treatment won't work the same way on every person. Why? The patient is individual, bio-individual. The food is the same. Today people are all going on high-fat diets, putting themselves into a box. But some bodies are not high-fat efficient. Everyone's scared of carbohydrates. But every body is not always allergic to carbohydrates. Some are carb efficient. If you're an athlete, you'll have a carb efficient body. If you're sedentary, carbs could become your biggest enemy. So you see, when you break down nutrition, it's a very individual approach. So Dr. Lee Williams leads angiogenesis at the Foundation of Angiogenesis. His job was to develop medication for a pharmaceutical company. During his journey, he said, hey, we're looking at so many medicines. What if I extend a research study and look at foods? And he found a ton of foods that can have the same effect, not replace medication. And today, those foods, I'm very proud to tell you, are the simplest foods available in the Indian diet. They're not the exotic foods that we need to spend a lot of money on. They're simple foods, the right quality, eaten at the right time, all of this together. You could eat the healthiest meal at midnight, or you could eat that meal at sunset. The way your body breaks that down and extracts nutrients is very, very different. This is where lifestyle comes into play. Nutrition is your first pillar. It doesn't have to be complicated. It doesn't have to be restrictive. It has to be smart. Today you have a lot of people saying that, hey, Luke, I want to go on a juice diet, and I'm going to get rid of my cancer. No, you're not. You're not going to get rid of your cancer. You still got to take your treatment. You've got to use a juice where you can, depending on your body type, depending on your digestive system. So nutritional science is also teaching us today how you can space out protein. You know, because a lot of cancer patients, during their treatment, they have low stomach acid. If you have low stomach acid, you cannot break down protein into amino acids, which can then get absorbed and contribute to the weight gain of a patient. So we're learning how to space out their protein requirement in intervals for better absorption. So nutrition remains one of the fundamentals of lifestyle medicine. Now let's talk about exercise. There are 4 pillars. Let's talk about exercise. You have sedentary people, and you have people who are overtraining. You have people who finish a chemotherapy session and get into heavy exercise almost immediately. What we need to understand today is movement is important, and exercise is important in your treatment, but at the right time. A lot of people, they finish a treatment and they say, we want to run a 10K. And everyone's, yeah, you're a warrior, go do it. But the body's not yet ready for that. You can run a marathon at the right time. But your movement, which involves blood circulation, is extremely important for your healing and your recovery process. And we live in a country where we have a variety of exercise programs and yoga. And we have pranayam. Today, the same institute that treats our Prime Minister and teaches him yoga is the same institute that has put science behind certain asanas that can be used for lymphoderma, certain asanas that can be used when mobility of a cancer patient is restricted because of lymph removal. And the point is, how do we integrate these free exercises that are available into the treatment of a cancer patient? So exercise becomes our second lifestyle. It's not a choice, it's mandatory. The third, which is the biggest, is sleep. A lot of people say, what are the most common lifestyles that you notice in your cancer patients? We see on an average 400 patients in a month. And let me tell you the two most common lifestyles that we see in patients. It's not really food. It's not really a lack of exercise. These are contributing. It's sleep deprivation at the top and chronic emotional stress. And when you break it down, when you're chronically stressed, you can't sleep. We know the scientific impact on chronic sleep deprivation on your cells, on your immune system, on your gene mutation, on inflammation, on everything. That's the basic. And sleep is free. But unfortunately, everything that's free is usually taken for granted. But sleep deprivation will now lead to bigger problems, the wrong choices of food. When you're sleep deprived, what do you crave? Do you crave fruits? Do you crave nuts? No, you'll crave sugary foods, anything that excites the brain, quick energy. So the impact of sleep is direct and indirect on the diseases that we have. Dr. Agarwal spoke about the importance of lifestyle and the prevention of cancer. While there are amazing drugs that will come into the market, and while our oncologists and scientists will go on with advancements in science, what about the fundamentals? That is our responsibility, putting in the fundamentals of living, of lifestyle. And sleep deprivation is at the top. It's at the top. We know sleep deprivation and the impact on hormones. We know the impact of sleep deprivation and the increase of estrogen in the human body and the decrease of testosterone, which we can medically relate to a lot of conditions that slowly creep into our body. And then the fourth pillar is emotional wellness, chronic stress. I'm not talking about your day-to-day stress, your job, your time in the train, your wife fought with you, your husband fought with you. I'm not talking about that stress. I'm talking about chronic stress, the impact of excessive cortisol, adrenaline burnout in the body, on your immune system, on inflammation. So while you would be spending a lot of money on your treatments, your doctors are working around the clock on your treatments. We reduce the possible efficacy of everything that goes into our body because of our lifestyle. We know today that medicine can save lives. It can take away pain. We also know that medicine can be misused and abused. What do I mean by this? There are so many patients who start chemotherapy and they just never go back to complete the cycles because of fear, because of other issues, lack of awareness. So the beauty of lifestyle medicine and why I like the slogan, United Against Cancer, is because all these little bits now have to unite together. It's not about, hey, just take the chemo, sleep is bad for you, or just take the drug and you'll be better. It's everything together. And I think Dr. Agarwal, Dr. Badwe, I know a lot of his patients come to us. He stresses on the fact, sleep well, rest, reduce stress. Are you eating well? And then we have environmental factors like pollution, out of our control, pesticides in food. A lot of it is out of our control. But does everyone have cancer caused by pollution? The answer is no. Does everyone have cancer caused by pesticides in food? The answer is no. What is the difference? Our immune systems. The intelligence of our immune systems. Early detection, screening, awareness, education, all of these things together. So while oncologists do what they're best at, while the farmers do what they're best at, how do we use lifestyle medicine, which is free in the beginning? But like one of the doctors on stage said, the cure becomes expensive. But lifestyle is free. We don't have to spend a lot of money on exotic foods. We don't have to spend money on exercise. We don't have to spend money to sleep better. And we don't have to spend money to fix what's happening in our heads and in our hearts. And that is the basics of the entire fundamental of lifestyle medicine. Before I end, I want to talk about medicine beyond medicine. While these are the fundamentals based on human biology and anatomy, you have medicine. What about medicines beyond medicine? The use of nature, sunlight. How much time do we spend in nature? The power of prayer, the power of faith, the power of spirituality, which is so deep in our country, but we don't use it. It could get us out of a lot of stress that we face every day. So there are a lot of medicines beyond medicine. Most of them are free. When we integrate it with what we have, we can make the model of preventive medicine very, very strong. And even if we're suffering from a cancer, and now we're integrating lifestyle with genetics, with chemo, with everything, your chances are way, way higher. And that is the power of lifestyle medicine. And I want to encourage everyone to understand today, while we have medicine, while we have all the treatments available, we also have a human body that requires great food, movement, sleep, and sound emotional health. Thank you.
Thank you, Luke. That was very enlightening. And now on to the final conversation of today's evening, and indeed a much awaited one. Each individual on this panel is a living testament of how human spirit can defeat any odds. Let me first invite on the stage Anand Narasimhan, our Managing Editor of CNN News 18, for leading this conversation, and to welcome all our guests. Introducing our first panelist. She is not just an acclaimed actress, but a true warrior who has triumphed cancer. She is an extraordinary individual who embodies resilience, courage, and the indomitable spirit of survival. Please join me in welcoming the phenomenal Lisa Ray, who now has decided to lend support to our campaign Sanjeevani. Ladies and gentlemen, a huge round of applause for Lisa Ray. We also have with us living legend, a symbol of resilience and a true inspiration, Mr. Yuvraj Singh. In November 2011, just 7 months after India's historic World Cup triumph, the cricketing world was shaken by the news that Yuvraj Singh was battling tumor in his lung. His spirit shone brightly as he embarked on a journey of chemotherapy and treatment. He didn't just battle cancer, he shared his journey with the world, offering hope and strength to countless others. And we await to hear about that journey once again. Our next guest on the panel is acclaimed Indian filmmaker, the incredible Mr. Anurag Basu. In 2004, life took an unexpected turn for Anurag when he was diagnosed with blood cancer. The prognosis was grim, with doctors giving him mere 2 weeks to live. However, he is a master storyteller both on and off the screen. And we'll hear more from this panel on these wonderful stories. Over to Anand to lead the conversation forward.
Ladies and gentlemen, thoda dil se swagat kijiye. Please welcome all of them. Phenomenal people, fighters, survivors, and great achievers. Such a pleasure to have you all. Thank you so much. Now we are on the munch of Sanjeevani. It's United Against Cancer. All of you are survivors. And it is perhaps to take the story of hope forward and multiple challenges. So if I may start with you, Lisa. You went public with the diagnosis and you chose the platform of the Toronto Film Festival. That takes a lot of courage. Now where do you find that courage and why did you do it?
Thank you, first of all, and thank you for having me here. I'm very honored to be sharing the stage with Yuvraj, I'm a great admirer of his superhero qualities, which for me I define, sorry, I don't really actually watch cricket, if you can believe it or not. But, you know, for his incredible resilience and also the philanthropy that has followed his battle. And Anurag, of course, I am a great admirer of your craft. And then, you know, my admiration goes even deeper after understanding what you've been through as well. Yeah, so, you know, I think that cancer as a disease is also so multi-layered, and I think that there's a lot of misunderstanding. There's so many different types of cancers, and each cancer comes with its own prognosis, diagnosis. It's actually all put in one bucket, but they're very different. And you know, the point of that is that each patient, their journey is so incredibly individual. And I guess for me, when I was diagnosed, I was 37. And you might say I was riding on a bit of a high in life. At the same time, I was ignoring a lot of the signals that my body was giving me. And, you know, like everyone, I was sort of had fallen prey to that hustle culture. And if I was feeling really fatigued, I would just, you know, maybe cut out my rice, drink more coffee. But, you know, I do anything except go to the doctor, which is my bad. And finally, I couldn't ignore the signs. And, you know, the investigations led to me being diagnosed with multiple myeloma. And it just so happened that everything coincided. I was diagnosed in August of 2009, and I had a film coming out in the Toronto Film Festival in September 2009. So I was obviously put in a very strange situation because I immediately started treatment, and part of my treatment was steroids, very, very heavy steroids. And anyone who's been on steroids knows that they will actually change your appearance. So I bloated up, you know, I was 40 pounds overweight, and that's not a big deal when you're saving your life, but when you have to step on the red carpet, it's a bit of a big deal. So I had to make a very quick choice about whether I hide or I could actually use this particular event of being on the red carpet, which is often used to talk about glamour or film release, or in the case of women, you know, often women are sort of criticized and, you know, basically torn apart, you know, on the red carpet. I realized that I could actually subvert that moment to, first of all, talk about my cancer, which is a very relatively rarer cancer. You might call it an orphan cancer. And as we all know in the cancer community, the louder, more strident cancers get more research money and more attention. So I realized maybe, even though I was grappling with this really distressing situation, I thought maybe I can actually use this situation, first of all, to bring a little bit of attention to my cancer. Second of all, I felt like maybe it will break this stigma, because I personally could not understand why everybody around me was advising me not to speak about my cancer publicly. It didn't make any sense, because first of all, I didn't feel I was to blame. And then second of all, we know that cancer is something that is becoming more epidemic. You know, everybody knows someone who's affected. So why are we pretending? Why are we hiding this? Where does the shame come from? And the third question, which was even more deeply personal, was I had actually always felt very deeply uncomfortable on the red carpet. I didn't feel I belonged there. I didn't like being, you know, sort of critiqued and pulled apart as a woman, or simply only judged on my appearance. So I felt that I could take all of these three factors and put them together, stand on the red carpet, 40 pounds heavier than my normal weight, but actually feel very empowered by this moment. And, you know, when I wrote my book about it, I said that actually my shoes don't fit because my feet were so swollen, but ironically, I actually stepped into my body in that moment. And it also gave me purpose. When you're fighting cancer, for me personally, I guess I needed to also find a greater purpose, something larger than myself, also to distract myself. So to be honest, it wasn't courage. It was all of those reasons.
But it still was a lot of gumption to be able to do that. And if I may just quickly back to you, Lisa, on the relapse that happened in 2012, that's a double whammy. How do you deal with that? Okay, you found the courage, the grit, the determination to fight it once. How do you fight it again? What went through you then?
So the second round was obviously significantly different. I'd learned so much more about myself, my disease. And I just felt, because the first one was a huge slap in the face, because it was sudden and dramatic. The second, when I relapsed, we were monitoring my protein levels in my blood, the protein marker in my blood, so I could see slowly the relapse was happening. So my oncologist sort of prepared me. She said, you have to go in for treatment again. And in my case, it often means a stem cell transplant, which is not a picnic, not something I would actually advise. But I just felt deep inside that, look, I'm missing some part of the puzzle. like there is a message coming to me beyond myself. Secondly, I just gotten married. So I was like, I have to fight this disease. Otherwise, my husband's going to want a refund very quickly. Like we had literally just gone through the shadi, everything like that, setting up a new house, etc. I don't know where, I mean, you could say that I have a quality that, you know, my mother would have argued was very irritating, but has somewhere come in handy. I'm very stubborn. I'm very stubborn, so when I see a challenge, I refuse to back down. And I think that I understood with my relapse that my body, again, was trying to communicate something to me. So what I ended up doing, that's when I ended up taking the holistic world, or what we call complementary, alternative, I don't know the exact terminology you want to use, that I'm aligned with, and mix that very, you know, enmesh that with allopathic medicine.
Okay.
Because I decided to go back on maintenance therapy, so I was taking the drugs that my oncologist advised, but I also went off and changed my lifestyle, you know. I mean, it's very enlightening to hear also, like the way that Luke described it, you know, of enmeshing the two. That really is something that somehow or the other I stumbled upon through trial and error. And I went off to a retreat center called the Hippocrates Health Institute. And, you know, this is a very famous thing. I know it's been said before, but it bears saying again that Hippocrates, you know, all the doctors take the Hippocratic Oath, right? In order not to harm patients, etc. But Hippocrates apparently very famously said, let food be thy medicine. And we don't talk about that enough. And so in this center, I learned a lot more about, you know, lifestyle changes, how to feed myself. We did a lot of, you know, alternative things without ever giving up my medication. So it was not one at the expense of the other. It was actually became a beautiful marriage. And you might say that I'm still propped up by that marriage even today. So that's, you know, and by the way, a very quick thing. So my oncologist was very skeptical about all of this. But I went off and I did my treatments, and I saw a lot of also people who helped me, also emotionally, spiritually, all of that stuff, while taking my medication. After 3 months, I went back and saw my oncologist, and we were supposed to prepare for my stem cell transplant. And my cancer was gone. It was gone.
Wow.
And you know what she said to me, of course, being a good clinician, but now she had become a friend, she said, listen, I don't want to know what you're doing, but just keep doing it, whatever you're doing.
Yeah, day in and day out, you've got to do it. Big round of applause for Lisa Ray. You know, you can go on endlessly in terms of conversations, because there are so many lessons. Every line she said, there is a lesson to be learned. Just like there is a lesson to be learned from the man who was told that he's just got 2 weeks, and that was what, 20 years ago? 2004. So it'll be 20 years in 2024.
Yeah.
You're going to be a parent, and leukemia hits you. And here you are, Anurag Basu. Tell us your story.
Yeah, in a typical Bollywood screenplay, when everything is going right for the main protagonist, you know, there is a twist in the tale waiting for him.
He will
and he will relate and she will relate. Abhi dukho ka pahar phutega uske upar. Aur fir phutta hai. So, same thing happened. My film was hit. I was signed, super hit, and I was signed by many producers. My wife was pregnant, and then this happened. And yeah, so I was being treated in a hospital where the doctor said 2 weeks. Because I don't blame them, because the line of treatment they were, you know, I was going through is not working on my body. And I was deteriorating every day. Then I got shifted to Tata Hospital. And so it was, I remember when I was shifted to Tata Hospital, I was actually bleeding buckets of blood that time. Every internal organ were bleeding inside. And when I thought I would die in an ambulance when I was shifted to Tata Hospital, I was so bad. And immediately after Tata Hospital, I reached there. I was taken to ventilator. I was inside the ventilator for 3 weeks, actually, in fact. So it's nice if we talk about willpower and miracle, I'm here, but actually it's my oncologist, my doctor. because I was senseless. I was in my ventilator. I didn't know what was happening with me. And my family was suffering. My caregiver, my family, my wife, my mother, my father. I was senseless. So I think we all have different paths, different ways to recover. We all are, but bottom line is, the decades of research done by scientists and the doctors, they have made the recovery easier. And I've personally seen my doctors, Dr. Banavli, Dr. Badwe and his team there. They are amazing people. I've seen them. You know, the day in an oncologist's life is much longer than ours. I believe I'm a workaholic, but they are work fanatic. They are amazing. And it takes, a lot of courage. I think, and it's very important for any treatment to have that trust with your doctor. Yeah. And yeah, that was it. And so yeah, first, after the whole, when I came back to the ICU, the first hurdle was over. I was out of ventilator. Yeah, then there was a small fight. The first thing I really wanted, I was not sure how long I'm going to live because my body was saying I'm not well. So I made small target. The first target I made, I want to see my baby's face. Yeah. That's the first thing I told myself. That kept me moving actually. I just really wanted to. So that's how I just.
So 2 weeks became 2 months, 2 months became 2 years, and
yes,
now
absolutely.
it's going to be 20.
All thanks to my doctors and the team, amazing dedicated team of Tata Hospital. I would not take any credit because.
Did you change anything? Kuch badla apne after that? Did you change anything in your lifestyle, in your approach to life?
Lifestyle तो देख रहे हो आप थोड़ा सा मैं वजन. Lifestyle बहुत ज़्यादा बदला नहीं, sorry. लेकिन हाँ, मतलब outlook towards life got changed completely. I see life differently now. My movies got changed. The story I tell got changed. अपने आप हो गया ऐसे. It was effortlessly and yeah, actually, what? It never. I embraced cancer very soon. I never questioned. I didn't have that syndrome of why me, why now. That never sinked in actually. That really helped me to recover faster.
Yeah. If you don't get into that self-victimization,
Yeah.
self-pity kind of thing, aa gaya, chalo kuch karte hain. Let's do something about
Exactly.
it. But it's not as easy, isn't it, UV? Man of the Series, 2011 World Cup, everything's going for you, start of the moment, and suddenly this entire talk about the diagnosis, I still remember. Not easy. And you've gone further, you've not just beaten it, you've come back, and then you've started UV Can, so it's a lovely journey. But take us through, how did you pull through? Kaise kiya?
Well, first of all, listening to Mr. Basu's story, obviously I heard about it, but when you actually listen to it, you can actually relate to what the person has gone through. And obviously with Lisa, hearing her story, it amazes me that she's done it twice. She's fought twice. I would say probably the strongest person in the room right now. I don't think if I would have to go through it again, how would I fight it? So, it's easier said than done. Yes, you don't watch cricket, but I watched a lot of your films and had a big crush on you when I was younger.
I knew this was coming.
I thought it's a cancer event. I shouldn't be saying these things, but I'm an honest guy.
No, but you're not the only one.
Yeah, I'm sure. बाकी लोगों के पास mic नहीं है ना. Mic मेरे पास है तो मैं बोल सकता हूँ. But coming back to being a survivor in the room, being a fighter, I think when you talk about, when I relate to people on the dais, I think it's a fight within. It's a struggle from inside, which only you understand, and your family members have gone through. Like Lisa, if I would relate to your husband, probably would be very proud of that guy that he stood by you when you got diagnosed of cancer again. So in our families, my mother has seen me. It's like she's giving me birth twice because she was there through the journey. And as you said, 2011 World Cup, when we won, probably the highlight of my career. We won the World Cup after 28 years. I was, 29 years old, I was probably the peak of my career. I was speaking towards, maybe breaking some more records, but unfortunately, when the doctor told me that I have cancer, I'm like, this guy is definitely not a doctor, because how can I have cancer? I'm an athlete who trains 5-6 hours a day. I eat well. I'm a superior gene, which I'm not. Now I understood that. And life strikes you in a way which you are not expecting. And you realize that you're just another human being. And, that obviously I started searching that, more than 8 lakh people in India were going through cancer. And then you realize that, it can happen to you. So it took me a while to come to terms with it. And I was playing and I was getting worse. And then eventually my doctor said that you have 3 to 6 months left. Now it's your choice. You want to go on the cricket field, die there, or come and get treated. I was like, I don't mind dying actually, because I don't want to stop playing. That was my biggest fear, and we all have fears. I think the fear of cancer is more than actually going through the treatment, because it scares you for life. And as Lisa said that, she spoke about it, and I thought, when I was hiding away from it, and when I came to terms with it, I was like, this is my time to talk about it. And, be inspiration for people out there that I'm fighting it. I'm sure people in your family are fighting it, and, together we can do this. I mean, that was the whole reason of me coming up with my foundation, that UV Can meant was that we together can fight cancer. That was the reason why I wanted to come back and do something for my society. And, realizing that how cancer is harming our society. So I think through the journey, I got a lot of inspiration out of it, inspired a lot of people. And here I am with the survivors in the room, marching forward.
Let me put this to all of you. I'll start with you, UV, and then Anurag, and then we'll come through to Lisa. What would you peg, because the idea is one screening, the other one is, detection, then you look at treatment. The earlier you detect, the earlier you screen, the better. But in your experiences, what is the one thing, if is changed, you stand a higher probability of beating this disease?
Well, as Anurag said, that your perspective changes of life, and you might look weak from the outside, but you're much stronger from the inside. And obviously, your lifestyle changes. You have to change your diet, and you have to look after your body like a little baby. But the point is that mentally, it definitely makes you stronger. It makes you stronger from inside. And like early on, probably if you break a finger, break a leg, you go through surgery, you're always thinking, why me? And I think after cancer, like, everything becomes very secondary now, because you've gone through such a tough battle in life. Everything becomes like, it's just fever. It's going to subside in 2 days. I broke my leg, probably will be fine in a month. So everything looks pretty mediocre. And then your perspective in life changes, that I am ready now for anything in life, whatever comes. And I think that's the kind of inspiration we want to bring out in people who are following you, who listen to you. That if I can come back to where I belonged, I'm sure you can come out from your adversity as well. I think that's the kind of people we've become now.
Did your body change, or did your psyche change when you recovered and then you wanted to get back onto the cricket field, right? You wanted to prove to yourself. How difficult was that? Or did you feel that kuch to badal gaya hai, it's going to be tough?
Definitely my body changed, and obviously, put on weight, and I just looked at myself in the mirror. I had no hair. I didn't like the look of it. And I mean, you come to terms with it, and then I want to get back on the field. People said that I won't be able to play again. I came back and played in 6 months. I was not fully fit. I went back to training, went to training for almost a year. Took me a year and a half to get back to full fitness, and it was just mind over matter. And everybody said that he would not be able to play again, and I came back and scored my highest one-day score. So it is you who has to decide your journey, not what people's opinion about you.
Well, where do you find the strength? Two parts, Anuragji. I want to ask you this. Did you ever think, okay, I've got it, you accepted it. Did you go back and think, how did I get it? Not about why did I get it, how did I get it? And the other aspect is, can everybody really dig deep in their heart and their head, say, all right, I've got it, let me fight this out? It's not that easy as it is to say it.
Yeah, as I said, everybody has their own method to fight it. And I had that question, why, from where, reasons. I asked everybody, I Googled, I asked my doctors, but nobody knew the real reason why I got that cancer. And I'll tell you my method. I just tell you, I just made small targets for myself because I couldn't get up off the bed, and there was this bench, the stool, which was just 2 feet away. And it took me 1.5 weeks actually to go there and sit there on my own. So that was my first target. I will go there and sit on my own. Then the next was to go to the loo. I wanted to go to the loo myself, so it took me another week. So I created small targets for myself. Then coming out of the hospital, going on set. In fact, Gangster I shot. Everybody told me not to shoot during chemotherapy. I asked my doctor, Dr. Banavli, I said, sir, I'll take all my precautions, let me shoot. And I think I was in Korea, I was shooting that film. And I had all the mask on and everything. And so I shot Gangster during my chemo. And so that was, so I think by working, that kept me away because, it's the only thing, which makes me positive is the work, creative work, thinking of stories, directing. The thing I love, whatever, you love, whatever you're passionate about, put your mind into that. And that becomes easier to fight the disease, actually. I thought I should be going on set and directing movies to fight with it. So that was my method, actually.
So stick to your passion and allow your passion to
absolutely. Whatever drives you, whatever makes you happy.
Whatever makes you happy.
Yeah, I made a playlist of Kishore Kumar's song because it made me happy. I used to listen to that in the hospitals. Whatever made me happy. I did everything, whatever made me happy. And more than that, your caregivers, your people who are close to you also have that mindset. Your mother, your father, your wife, they should have that mindset because, you're looking at their faces every day. They're coming to you. And
that's true. And I wanted to ask you that. Did you ever worry that is the way my husband looks at me, is the way my loved ones look at me, is that going to change? Were you looking for that change in the look? And because that perhaps is the biggest hit on you, right? Because you feel that if they've given up on me, who's going to back me out? Did that worry you?
Yeah, that's a very interesting and good question. See, fortunately, in my second round, I didn't lose my hair, I didn't change physically. I actually improved physically because, of my story of combining my allopathic and my holistic. The first time round, I changed significantly. And, I remember I took a selfie of myself and I started writing a blog.
The Yellow Diaries.
The Yellow Diaries. Yeah, you've done very good research. And, the secret today that I can share is that I actually am a thwarted writer, or now not so thwarted. I'm an accidental actress. I always wanted to be a writer. And, again, when you're dealing with cancer and your mortality, and, you have nothing to lose, you just throw yourself out there, just like what you were saying, Anurag. I realized that I've always loved writing more than anything else, even acting. So I said, how do I get through this? Let me write. So I chronicled my, my experiences in this blog that later on turned into a book, and now I'm writing my next book. And that is, it's ironic that cancer helped me to really commit to a passion that I'd hidden my whole life. So there were unexpected gifts, but of course you have to survive cancer in order to discover them. But I wanted to actually say something, sorry, circle back to
Yes,
something
please.
that Anurag had said about, again, the appreciation he was expressing to his doctors and, the medical community. I want to just share that my disease, multiple myeloma, when I was diagnosed in 2009, I was given approximately 5 years to live. And, if you had been diagnosed a decade before me, because I know someone who had been, you were given 1 to 2 years to live. And today, if you are diagnosed with multiple myeloma, it is almost transformed into becoming a chronic disease, as in something that is like diabetes. You take your medication, and maybe it's not fun, perhaps you have to do a stem cell transplant, but there is today so much hope, and the prognosis for patients has been radically transformed. And this we owe a huge debt to the medical community. So I want to thank again all the doctors, all the researchers, everything that goes into extending patients' lives, because I understand what it takes. Research takes many, many years, and then getting a drug to the market takes so many years, and it's really painstaking. And sometimes, perhaps, even great researchers, even doctors might not see the patient at the end of it. So as the patient sitting here, as all of us maybe, we all really want to thank you all for the great work that you do. We're here today because of you. And because of the advancements in the medical community. And I keep track of things. I make it my business now to keep track of innovations that are coming along in cancer therapies. I know that, for instance, immuno-oncology is huge in blood cancers now, right?
Yes.
There's huge, incredible hope and promise that's happening in immuno-oncology. So we have to keep talking about that. What we need to do is spread this word of hope. Also, not just patients, but I think to society in general. Because I want to share one other little anecdote. I have a very dear friend, and I know that this is quite typical, and she's just been feeling under the weather. And I was with her in Bombay, and I said, you should just go and get yourself checked, just go and check all your markers. And her first reaction was like, no, I don't want to know. I don't want to check anything. And I said, you think that if you don't get tested, somehow you won't know, but everything will be fine. And I don't want to judge her, but I just want to highlight this fact is that a lot of us do live in that. I was that person, before I was diagnosed. Now I'm completely transformed, and I'm the first one, I will take you by the hand and take you to the doctor, if I really care about you and I want you to get checked. But I was someone who avoided also doctors and the medical fraternity as much as possible until the last possible minute. And that's why we need to discuss this, because there's no reason for that fear anymore, because first of all, we're sitting here today. We all have gone through our journeys. They've all been really difficult. But not just that. I mean, again, medicine has evolved so much. And also early detection, really, we always say prevention is better than the cure, right? So that's really what we should be talking about.
Well, time's up for this conversation, but with the promise that we'll continue this through the course, and it doesn't end here. This is just the beginning. Yuvraj, Anurag, and Lisa, big round of applause for them. Thank you so much for joining us here on this platform that is Sanjeevani, where we plan to be united against cancer. Thank you very, very much. Thank you. Before we go down, I just have a request. Can I pin this on you? This is a cancer ribbon, with your permission. big round of applause for Lisa Ray, Anurag Basu, and Yuvraj Singh, ladies and gentlemen. Thank you so much. Thank you. Thank you.
And thank you, Anand, for that wonderful conversation. Indeed, that was the note on this, on which this evening had to end. With that, we have come to the end of this launch event, Sanjeevani-United Against Cancer. But before we wind up, we extend our heartfelt gratitude to each one of you for joining hands and lending your support to this initiative, which focuses on raising awareness about crucial importance of early cancer detection through regular screening. By being a part of this campaign, you have taken a proactive step towards fostering culture of prevention and well-being. Your willingness to engage in conversations and share this information, promote regular screening, is a huge step forward. Let's continue to work together towards a healthier and a happier future. Thank you so much for being a lovely audience today, and good night.